Okay, YouTube, as y'all can tell, it is January 7th, 2020, and we're here with the ultimate video. I haven't done one of these comparison videos in a long time, and it's going to be a lengthy one, so get your snacks and stuff, because, oh, and look at the timestamps below, just in case y'all want to know which parts of the video I'm discussing, whose policies. So that will be down in the description box. No, in the comment section below. It'll be pinned to the top of the comment section. But today, we're going over Bernie Sanders. Yes, this is one of the rare times I put Bernie on the channel. So Bernie Sanders, Elizabeth Warren, Marianne Williamson, and Andrew Yang. We're going to compare all four of their healthcare plans in detail. So I'm going to read it all throughout, and then we're going to compare and contrast. So we're going to see in real time whose healthcare plan really reigns supreme and why I personally favor Marianne Williamson's healthcare plan overall. You're going to see how Andrew Yang stacks up, and Joe Biden and everybody else. It was like it wasn't even a point. It's like, so yeah, for obvious reasons, we comparing the top four. So getting into it, we starting off with Bernie Sanders. So he starts off with healthcare as a human rights, Medicare for all. We say to private health insurances, whether you like it or not, the United States will join every other major country on earth and guarantee healthcare to all people as a right. All Americans are entitled to go to the doctor when they're sick and not go bankrupt after staying in the hospital. I can agree with that. Then he goes into his key points: create a Medicare for all single-payer national health insurance program to provide everyone in America with comprehensive health care coverage free at the point of service. No networks, no premiums, no deductibles, no copays, and no surprise bills. Honey, no more darn gone letters in the mail, honey. Would be nice, would be nice. Continuing on. Medicare coverage will expand and improve to include dental. Honey, I need it, honey, because I got a whole tooth I need. Is it going to include implants, Bernie? Because a girl needs an extraction and I need two dental implants. Tell me something good. You got your hearing, your vision, and home and community-based long-term care. Okay, so our senior citizens, you know, my great-grandmother suffered from Alzheimer's, and she had it for 15 years before she died, and she ended up having to go to a nursing home during my sophomore year of high school. It was within a week after my grandmother died. My great-grandmother ended up having to go to the rest home, but that wasn't the sister that took care of her. My oldest aunt was my great-grandmother's caretaker, but it got too overwhelming. She ended up, and we only had CNAs, and CNAs could only do a certain amount of time, and usually it was the daytime until like some part of the evening. But we didn't have the money for round-the-clock care, so I wonder if it includes, those issues as well for people who suffer, from Alzheimer's, dementia, and other forms of impairments like that. But it goes to say inpatient and outpatient services, mental health and substance abuse treatment, reproductive and maternity care, prescription drugs, and more. Stopping the pharmaceutical industry from ripping off the American people by making sure that no one in America pays over $200 a year for their medicine they need by capping what Americans pay for prescriptions under Medicare for all. Okay. I can see some possible flaws with that one though, but I get into that one late. I describe right later on. Today, more than 30 million Americans still don't have health insurance, and I'm a part of that for the time being. I've been unemployed for 6 months, but I just got some good news today, y'all. Look out for a personal vlog video. And even more are understood. Even for those with insurance, costs are so high that medical bills are the number one cause for bankruptcy. Oh Lord, in the United States. Incredibly, we spend significantly more on our national GDP on this inadequate healthcare system, far more per person than any other major country. And despite doing so, Americans have worse health outcomes, a higher infant mortality rate than countries that spend much less on healthcare. our people deserve, especially Black Americans. We're the ones that are disproportionately treated the worst when it comes to birth in the hospitals. But that's a whole nother video for a whole nother day. We should be spending money on doctors, nurses, mental health specialists, dentists, and other professionals who provide services to people and improve their lives. We must invest in the development of new drugs and technologies that cure diseases and elevate pains, not wasting hundreds of billions of dollars a year on profiting huge executive compensation packages and outrageous administrative costs. Okay, so this is something new, and I'm going to interject on this. Now, I didn't see this now, and I know the last time I looked at this, Bernie Sanders was not mentioning this. So, Marianne Williamson is rubbing off on you, Bernie. Because y'all know I've been up on the date on everybody's policies, and I know when stuff changed. Honey, this wasn't in here the last time I viewed this. So, y'all know this is why I do these types of videos. Because I clock the changes in real time. So, even though Marianne is been slacking down, I see she's finally rubbing off on some people. Now, y'all going to see why I mention that later on. Hold on, y'all. My lamp done fell. This is one thing I want to replace in 2020 is this cheap darn on lamp over here is weak. Okay, I'm back, y'all. Darn on cheap lamp done fell down. But anyways, the giant pharmaceutical and health insurance lobbies have spent billions of dollars over the past decades to ensure that their profit comes before the health of the American people. We must defeat them together. That means joining every other major country on earth and guaranteeing health care to all people as a right, not a privilege, through a Medicare for all single payer program, and to lower the prices of prescription drugs. Now we need to allow Medicare to negotiate with the big drug companies to lower prescription drug prices with the Medicare Drug Price Negotiation Act. Allow patients, pharmacists, and wholesalers to buy low-cost prescription drugs from Canada and other industrialized countries with the Affordable and Safe Prescription Drug Importation Act. Cut prescription drug prices in half with the Prescription Drug Price Relief Act by pegging prices to the median drug price in 5 major countries: Canada, the United Kingdom, France, Germany, and Japan. And that wraps up Bernie Sanders' plan. Now on to his main female counterpart, Miss Warren, honey. I don't know why I couldn't think of Elizabeth's name at the moment. And y'all know, don't shame me, but why did Pocahontas come to my head? I swear that I've been watching a little bit too much ABL, honey. Darn that, and ooh, I hate that they keep doing the Powhatan princess like that by comparing her to darn Elizabeth Warren. She's still my darn top choice nonetheless, you know, despite that darn huge mess up with that identity crisis of her family. But let's hope that her darn healthcare plan is not in an identity crisis. So it goes basically to reiterate the same thing that Bernie's plan said, that healthcare is a basic human right and we fight for the basic human rights. Elizabeth Warren won't stop fighting until everyone is covered and no one goes broke paying a medical bill or filling a prescription. Add your name if we agree. We need Medicare for all, and then you got to enter your name and zip code right there. And then I see hers is a little bit more lengthy than Bernie's. But, you know, for the sake of argument, let's see if I overlooked something of Bernie's. Because sometimes y'all say, oh, well, it was a link one that you didn't darn click on or whatever. So let's go back to the issues. We're going to be fair with Bernie real quick. Because it might have been indeed something. No, that's it. So, okay. I had to double check because sometimes y'all be like, Juan, no, you wasn't comparing it fairly. You didn't darn look at the links or nothing. Nuh-uh. So we ain't got no hyperlinks or anything. So we went over everything in detail with Bernie. Now once again, see, Williamson and Warren gets me confused because both of them got W in their name. So that's why I, keep slipping up and I almost want to say Warren. But Elizabeth, we're back on her plan. So it goes to say, my plan to end the stronghold of healthcare costs on American families My first term plan for reducing healthcare costs in America and transitioning to Medicare for all. When Elizabeth was in middle school, her father had a heart attack. He was put of work for a long time. Oh, he was out of work for a long time and the bills piled up. Y'all know my screen is cracked, so sometimes when it comes to words on this side of the screen, it looks darn on off to me. Just like my darn on focus. Oh my God, everything is just off today, y'all. Hold on. Okay, now we back. I know y'all saying, Juan, get it together. First the darn on lamp fell down. Then you struggling to look at the darn on words. Honey, we placing everything. We replacing this lamp. We replacing this laptop. And then this camera's going to eventually focus as soon as we get some new lighting. But continuing on, and the bills piled up. They lost their family station wagon, and they came about an inch away from losing their house. Years later, as a bankruptcy law professor, Elizabeth studied why working families were going broke. Her research showed that most people who filed for bankruptcy looked a lot like her family. Most were solidly middle class, and about half had filed for bankruptcy in the aftermath of a serious medical problem. And here was the kicker: about 3/4 of them had health insurance, but it just wasn't enough. The Affordable Care Act made massive strides in expanding access to health insurance coverage, and we must defend Medicaid and the Affordable Care Act against Republican attempts to rip health care away from people. But it's time for the next step. Elizabeth supports Medicare for All, which will provide all Americans with a public health care program. Medicare for All is the best way to give every single person in the country a guarantee of a high quality health care. Everybody is covered. Nobody goes broke because of a medical bill. No more fighting with insurance companies. The basic business model of an insurance company is to take in as much money as you can in premiums and paying out as little as possible in healthcare coverage. That leaves families with rising premiums, high deductibles, and fighting with insurance companies to try to get the health care that their doctors say that their children need. Insurance protecting their bottom lines restrict your network of providers and stand in the way when you want to see your doctor or need to see a specialist without going broke. Medicare for All solves these problems. Everyone can see the doctor they need. Nobody goes broke, and your doctor gets paid by Medicare instead of fighting with an insurance company. Every American should be able to get the care they need when they need it. This is a goal worth fighting for, and Elizabeth is to fight all that we need. Why Elizabeth will fight for Medicare for all. Lower cost prescription drugs. Prescription drug prices are crushing families. Millions of Americans are skipping their required doses and putting their health at risk because they can't afford to refill their prescriptions. Patients and public health programs alike are paying exorbitant rates, and we need relief. Elizabeth Affordable Drug Manufacturing Act will allow the Department of Health and Human Services to step in where the market has failed. HHS manufacturing generic drugs in cases in which no company is manufacturing a drug. When only one or two companies manufacture a drug and its prices have spiked, when the drug is in shortage, or when a medicine listed as essential by the World Health Organization faces limited competition and high prices. Okay, this is the first actual policy I've seen out of all this right here. Most of everything else has been story time, which we need to see a place of empathy for some of our competitors. But this is the actual first thing I'm actually seeing of, policies of how she planned on going by, enacted this Medicare for All. There is more to do to bring high drug prices. Medicare should aggressively negotiate with drug companies. We should crack down on rampant abuse of the patent and regulatory system, and we should import drugs from countries that sell the same medicines and meet strongly safety standards, but they charge their citizens a fraction of our costs. Okay, and I notice a difference right here. She vaguely mentions, negotiating with different countries versus Bernie Sanders was more familiar with the top countries that have the best Medicare for All system. So I'm going to have to give a point to Bernie Sanders on that. Bernie was able to name out France, Germany, Canada, and a couple other countries versus, Elizabeth Warren's platform just mentions the countries vaguely. So I'm going to have to give a point to Bernie Sanders. Then it goes into mental health. In addition to the right to physical health care, we must prioritize affordable, high-quality mental health services. Despite the widespread need for these services, many Americans are denied coverage. Elizabeth's Behavioral Health Coverage Transparency Act will hold insurers accountable for providing adequate mental health benefits and ensure Americans receive the protections they are guaranteed by law. She also worked to hold the Department of Health and Human Services accountable for improving insurers' compliances with mental health parity laws through an online consumer portal. And then we go into fight the opiate crisis. The opiate epidemic is a public health emergency. In 2017, life expectancy in the United States dropped for a third year in a row, largely driven by deaths from drug overdoses. This isn't the first time our country has faced a national public health crisis of great magnitude. When deaths from HIV grew rapidly in the 1980s, our country's medical system was ill-equipped to respond. Then in 1990, Congress passed the HealthCare Act, which finally provided significant funding to help state and local government combat the growing epidemic. Yeah, I bet you did once it reached your community, but another video for another day. We need a similar effort to confront the opiate epidemic today, and which I am definitely here for. Now, I'm glad that you're not demonizing people on opiates like y'all went and demonized people who was suffering through the crack cocaine epidemic of the 1990s, which is another reason why I'm not giving Joe Biden no time of day on here. Elizabeth's new CARE Act with Rep. Elijah Cummings would invest $100 billion in federal funding over the next 10 years in states and communities to fight this crisis, because that's what's needed to make sure every single person gets treatment they need. It gives directly to first responders, public health departments, and communities on the front lines of the crisis so that they have the resources to provide prevention, treatment, and recovery services for those who need it. Okay, one thing I have to highlight right here. So we're going to start mentioning some stuff midway through. I know that maybe she mentions it further on. Let's see real quick. It also works to strengthen our addiction treatment infrastructure. Okay, I was about to get on her. I was about to say, wait a minute. What about the treatment programs? But it goes right here. Demanding that states use Medicaid to its fullest to tackle the crisis, expanding access to medication-assisted treatment, and ensuring treatment programs and recovery residents meet high standards. Okay, now Elizabeth Warren, you talking to me. And Elizabeth's plan would help hold drug manufacturers accountable for pushing the powerful and addictive drugs that contribute to the epidemic. Okay. Come on through, Elizabeth. First, you was losing to Bernie Sanders, but you picking back up your momentum. Across the country's barriers to coverage, disappearing hospitals and health facilities, and a shortage of health professionals are denying rural communities the high-quality health care they deserve. Medicare for all will mean access to primary care and lower health costs for patients, and less uncompensated care for rural hospitals. Helping them stay afloat, Elizabeth will create a new Medicare designation for rural hospitals that reimburses them at a higher rate and offers flexibility of services to meet the needs of their communities. Elizabeth will also strengthen antitrust protections to fight hospital mergers that increase costs, lower quality, and close rural facilities. Elizabeth's plan will increase funding for community health centers by 15% per year over 5 years and establish a $25 billion capital fund to support a menu of options for improving access to care in health professional shortage areas. She will grow the current health workforce in rural communities by lifting the cap on medical residency placements targeted in undeserved areas by 15,000 over the next 5 years and increasing the National Health Services Corps and Indian Health Services loan repayment programs to the full repayment. Come on through, Miss Williamson. I'm at Miss Warren. See, I keep getting them confused. And her plan will invest in the future health workforce by dramatically scaling up apprenticeship programs between union high schools, community colleges, and a wide array of healthcare professionals to build a healthcare workforce that is rooted in the community. Okay. And then we go back to Bernie's real quick. Oh, this is a tough comparison. Because Bernie's is shorter, but he gets to the point of name dropping the stuff that he would do. And the price restrictions, he go into limited targeting, mentioning the Pacific price restrictions, mentioning the countries by names that he would negotiate with. Both of them mention the Medicare Drug Price Negotiation Act. Who wins this one? I feel personally, Elizabeth Warren. We're going to eventually get to you, Marion. But Elizabeth Warren just goes into describing it more in detail. I feel both of them are about neck and neck. But Elizabeth Warren wins me over by being able to describe stuff in more intricate detail. That's just me personally. I'm a Capricorn. So I love actually reading how stuff is going to get done. Versus, I don't know what sign Bernie Sanders is, but he's somebody that it looks like he just gets more just straight to the point. And I'm surprised on this issue because usually he has a whole list. Like, we done a video on Bernie Sanders, and one policy alone took me a whole hour to get through the whole video. And he has several more policies like that. So I was surprised that his main healthcare, Medicare for All, was so short. I was expecting it to be very long. But that's how, Bernie Sanders stack up against, Elizabeth Warren. Now we're going to go to Marianne Williamson. And personally, she's my favorite out of all of them. So this is why I personally like Marianne Williamson's plan the most. Y'all about to see right now. Healthcare in America. The biggest problem with America's healthcare system is that it is not a healthcare system so much as a sickness care system. It reflects an outdated perspective on health and healing in which far too little attention is given to the actual cultivation of health and prevention of disease. The shift to a genuine healthcare system would involve attention to environmental, agricultural, chemical, and nutritional factors which America's current corporate-dominated system of governance would presumably resist. Yet, if America is to deal with our serious issues involving chronic disease and obesity, we must look deeply at the causes of disease and not simply by their treatment. Honey, just that darn line alone just got me right there. Get to the root cause. Yes, Medicare for All is nice, but if we get to the root cause of what is causing the sicknesses, which is not just by nature's design, these darn diseases have been manufactured more times than not. We know that it's been confirmed that AIDS was invented to darn destabilize Africa, but it got over here in Americas and throughout Europe, and then you had to darn start treating people because your white population started going down. Then we got to have those honest conversations when it came to reason why, HIV, it has been rumored to have several cures that doctors have given to people that actually have shown to no longer show any signs of having HIV, but we still don't have it darn mobilized. Why? And then cancer and so much for. But I'm gonna let Marianne Williamson continue on. The Environment Protection Agency needs to have its power restored as a protector of our environment and thus our health. The Clean Air Act and Clean Water Act must be restored in full, and bans on dangerous pesticides once again vigorously established and enforced. Genetically engineered foods should be labeled. The Food and Drug Administration needs to have its power restored so that it can once again guard the American people from toxic substances that should not be on our shelves. contaminants in our water should be vigorously regulated, and our children's food, particularly school lunches. Honey, now she's giving me a little bit of Michelle Obama with this one. Now, I didn't appreciate Michelle Obama in the beginning when I was in culinary arts school, but now being more health conscious, I now see what Michelle was trying to do back in the day. So I'm definitely here with the school lunches. Should be far more filled with healthy ingredients. Until America comes to terms with how much we have acquiesced to the many unhealthy practices that should be considered unlawful, which it is in certain countries, because now I got to clap back at Bernie Sanders and the Bernie Sanders supporters. Y'all always talking about this Medicare for all and, negotiating with prices with countries that have lower prescription drug costs such as Canada and Germany. But what they also don't mention is the fact that a lot of people don't have to utilize those services because Germany ingredients when it comes to certain foods and the way that it's formulated over there is totally different in the United States. If you go get a soda over in Germany, it is not going to taste the same, even by the same company, because by law, those certain chemicals cannot even be doggone brought over to countries like Germany. So even when they have Pepsi over there, it's not going to be the same taste for that reason. And thus a lot less people are dealing with addictive sugar cravings and, all the side effects that come with sugar, tearing down your hair, your skin, contributing to your acne, and, wrinkles, aging your skin and all of that. All of that is avoided for the most part in Africa. Not to say that they don't have sweets, but they sweets are made with more raw sugars as opposed to manufactured chemicals. So I love that, Marianne Williamson is not only focusing on the health care, but the preventative care as well, which is something that I did not hear in neither Elizabeth Warren's nor Bernie Sanders' plan, but we're going to keep going on. But which are currently allowed in order to increase corporate profits. Come on and speak on it, Miss Williamson. We will continue to have a less than meaningful discussion on how a society will provide health care. The issue of health care in America strikes at a key question regarding America's first principles. Lincoln said, "We're to be a government of the people, by the people, and for the people." And it is to decide now whether or not we agree. A government for the people is just that, applying the resources of our government to providing such a fundamental right as access to health care should be a given, as it is in all other advanced democracies. Those who promote the idea that market forces alone should govern our society have promulgated propagandist memes to dissuade the American people from claiming the rights to universal health care. Okay, I see the author done jumped out at Marianne Williamson now. Come on now, Marianne. Giving us some of that college level vernacular, honey. Giving a girl like me some tongue tiedness, honey, on this darn recording. But words like socialist, too expensive, and nanny state are used to distract us from realizing that with a government of by and for the people, which also happens to be the richest country in the world, universal health care should be seen as the most natural thing in the world and a basic human right. Our government exists to work for us, not for health insurance companies or any other corporate entities whose short-term profits may or may not align with our ultimate well-being. And when we discuss who is going to pay for our health coverage, we should also discuss environmental, food, chemical, and agricultural policies that contribute to our being sick in the first place, policies that exist to serve nothing more than profit maximization for industries such as fossil fuel companies, chemical companies, food companies, health insurance companies, big agricultural companies, and pharmaceutical companies contribute to the chronic illnesses suffered by millions of Americans, such as myself, who suffers from Crohn's disease. Policies towards healthcare. Environmental policies such as gutting the Clean Water Act, overturning bans on pesticides, and disempowering the Food and Drug Administration from properly monitoring our food supply, damage our health. Big agricultural policies promoting and subsidizing cash crops over healthier options all contribute to the chronic illnesses that plague millions of Americans. The issue is not just the cost of healthcare. Come on, here we go with another word, honey. Marianne about to speak up on it. The issue is not just the cost of healthcare, but the larger cost we are paying. The human cost of being sick so much and so often, not just a cost to our pocketbooks, but the cost to our quality and even length of our lives. The Trump administration has proposed billions of dollars in cuts to the National Institute of Health, Center for Disease Control, and the Food and Drug Administration. If he is successful, I will restore the funding and add even more to it in order to ensure adequate government oversight over policies affecting our health. Okay, I'm seeing an error right here. I think she meant to say, if I am successful, I will restore the funding and add even more. It seems like she got caught up with, so what's happened right here is a little error. I think, she, in mid-sentence, she was still thinking about Donald Trump, but then we changed thoughts to say what she would do, but instead of focusing it in the feminine, she accidentally focused it in the masculine by still thinking of him as opposed to her. So I guess she meant to say if she is successful. So we either missing an S right here, or she meant to say I am, but was thinking about Trump and accidentally said he. So Marianne Williamson people, y'all got a little error to correct right here. Next time y'all update y'all platform, just update this sentence. But I still got what y'all was trying to convey nonetheless. So if she is successful, I will restore the funding and add even more to it in order to ensure adequate government oversight over policies affecting our health. Policy changes that help prevent and reverse chronic diseases. Come on through, Marianne. And cultivate optimal health will, in addition to helping Americans live more vibrant and healthy lives, save taxpayers trillions, not millions, not billions, but trillions, baby, of dollars. We need to do more than figure out who is paying for the whose disease. We need a president who understands the many policies that contribute to American illnesses. Come on through, Marianne, preach it. From environmental policies to chemical policies to food policies to agricultural policies to animal policies to pharmaceutical policies, the health of the American people should be of greater concern. A cause for concern. Yeah. Honey, I'm telling you, Miss Marianne is preaching the word, baby, to the U.S. government than the profits of corporate entities too often not held accountable for the toxicity their products produce. The cost of a healthy America. We're going into the second darn section, y'all. Some will argue that we cannot afford universal health care when in fact there are studies showing we would spend less money on a universal Medicare for all system than we do now. Moreover, there is no way to measure the amount of money that does not enter our economy based on the fact that so many Americans are too stressed and anxious to create and produce at the level that they otherwise could. What will I do if I get sick? What will I do if one of my kids gets sick? I hate this job, but I stay because of the health care benefits. Honey, ain't that the darn truth, honey? Every one of those questions is a limit on life that would otherwise produce more. This is why we need universal health care coverage. In the richest country on earth, millions of people should not be living with chronic fear and anxiety based on the difficulty of providing for the basics of life. The fact that such difficulty exists is itself a problem we need to address. For when we do, we face up to the basic inequity of the economic system that dominates our society today. Then it goes on to say further, the corporate dominance of our political decision making because of the undue influence of corporate money on our political systems has not only corrupted our politics, it has corrupted our food supply, our soil, our air, our water. In electing me president, America would elevate a leader who understands this and is willing to address it. In effect, we will have now is a disease management system, not a healthcare system. Yes, come on through, Marianne. Half Americans now have at least one chronic disease. 4 in 10 have multiple, from heart disease to diabetic to cancer, autoimmune disorders. Y'all know, once again, I beat cancer's ass in 2011, then only to darn on still deal with darn on Crohn's on a regular basis. To asthma, many chronic diseases are preventable. And guess what I found out? But I mention that later on, though. But she is right on, some of these diseases could have been preventable. Even when they have already manifested, it treated at the root cause. There are far more manageable to deal with, and often even reversible. Everything about American life today, including the economic pressure that leads 40% of Americans to living with the chronic stress over whether they can make basic costs of healthcare, rent, transportation, and education, and contribute to the higher trend of chronic disease. Pacifics. I robustly support a high-quality universal health care coverage for Americans. I will do this by making Medicare an option on the Obamacare exchange. Over time, more people will migrate to Medicare. Once again, and another thing that I like is the fact that she is not eliminating competition, because if other companies so choose to price match the government and go lower, they have that option, versus, Bernie Sanders, a point against him, a point for Marianne, is he wants to make, Medicare for all a monopoly, versus Marianne Williamson is putting it on the Obama exchange as an option for people to get free Medicare as an option. But if another company just comes out and wants to price match the government and actually provide a little bit more, because once again, who's to say they're going to provide, this tooth replacement? They might provide extractions and stuff, the basic stuff. But when it comes to more of some things that they might consider cosmetic, Bernie Sanders' plan might not cover that. And I would have to go seek out some. I know they said that certain insurances will still be able to be available, such as, cosmetic, dental services and stuff like that. But general health stuff, general health care, I think they said Bernie Sanders is trying to make the monopoly on that, which I am not here for. I'm not here for a monopoly. I don't believe that is very, hell, I don't even think Republicans would even go for that one. I can't even say that's a darn gone Republican-based issue or monopolies. They darn gonna support the high businesses that pay their dollars that are monopolies. However, Republican people in general are not for, nobody's for a monopoly, because then if the government controls the cost, who is you to say what is affordable? Affordability is only due to the price and demand. And so you can't never create a cost of what is deemed affordable. It's just your thought of what is presumed to be affordable to the average everyday people. But if a group of companies want to come out with a lesser price, automatically that little $200 that Bernie Sanders, which is affordable at the time being, that becomes, expensive. Once again, expensiveness versus affordability is only due to the price and demand of which the people you are trying to target. Which is, once again, is why I'm not against, eliminating competition in any aspect, even when it comes to private insurances that are mostly crappy. They still should have the right to be able to price match the government. So I am definitely with more Marianne Williamson on this, with, putting it on the exchange and common sense. Most people is going to go for the free 99 that's giving all this versus the, private insurance companies. And if they want to stay around, they by default have to darn go and price match the government and offer some extra incentives to stay around by default. And I think that's far better than trying to make a monopoly, because then when you make a monopoly and the wrong government entities get in control, then they can jack the prices up, and then it's nothing that we, the American people, can immediately do. And then our health will permanently be at risk. So once again, that reason right there is all the reasons why I support Marianne Williamson's plan specifically over somebody like Bernie Sanders. So she then goes to say, I support federal societies to ensure medical coverage for every American, even those in states which have refused Medicaid expansion. Honey, you about to get it now, baby. Those who wish to keep their private insurances may do so. Thank you, Marianne. Because Bernie was trying to take it away from some of the people. In addition, my administration will champion the following policy changes to help change our ill-advised trajectory. Require our healthcare system to reimburse medical professionals for a broader array of lifestyle and nutritional support focuses on preventing diseases and addressing the root cause. Come on through. She just wiped out darn on both Elizabeth Warren and darn on Bernie with that one along, in my humble opinion. Because once again, if we target the root cause, yes, if I still end up contracting a disease, it's nice to be able to have insurance to go to the hospital. But I love hearing people mention about preventative causes. And I know y'all going to say, well, Bernie mentioned that too. Y'all, you just highlighted it. But honey, I just want to mention this, that the last time I checked this out, Bernie talking about, funding cures for diseases, that wasn't in there. That was not in there. Marianne has been consistent, and you see who's really more consistent on this, because her platform goes into intricate detail. And when she's on her town halls, you can tell who goes in more details about actually tackling root causes and doing preventative measures. Yes, it's nice to have universal health care, but if I can avoid going to the hospital altogether, that will be the ultimate way to go. And Marianne is the only candidate that does both. She still supports Medicare for all. This is not the darn gonna say Medicare for all cannot happen. It's just to say let's also prevent people from having to do this in the first place. Let's focus on preventative care in addition to providing health care. And if you make less people sick, that's less money that the government have to come out anyways for Medicare for all. So by default, under Marianne Williamson presidency, Medicare for all would cost substantially less than under a Bernie Sanders presidency. Because if you're just focusing on treating, paying for the sickness, you're going to perpetually deal with the sickness. But if you focus on also preventative measures and post-care measures, then over time, the cost to the government decreases. So you see how Marianne Williamson's health care will cost far less money and be far more productive on the people and our economy versus Bernie Sanders. But when I was trying to convey this earlier, honey, a lot of people were saying that I was crazy, that Marianne Williamson, she was just doing too much. It was a pipe dream in the sky. It's something that it would take years and stuff to develop. Like I kept hearing all types of excuses in my comment section. I'd love to hear some of those opinions now that, we are doing a video of side-by-side comparison. So some of those same people who thought none of this could be possible are now listening to me go through Marianne Williamson's, and we only halfway done. So the fact that she has such a lengthy darn thing on this shows that she ain't darn pussyfooting about this situation. She is really going into very much intricate details. She's not just darn giving us a light darn surface level of, just a couple paragraphs. She even darn outdid Elizabeth Warren. Elizabeth Warren gave us a good darn amount too, but then we get to Marianne Williamson. This is how much she done gave us. And we only halfway done. But then she goes into number two, longer visits with doctors and or their support staff to better equip patients with skill necessary to make lifestyle changes, provide patients with more robust ongoing support for nutritionists, health coaches, therapists, and mental health exercise specialists, and other peripheral lifestyle treatment providers. Now, now, when it came to this part, I think Elizabeth Warren picked up on some things. Because did we hear Elizabeth Warren mention stuff about, let's go back to hers? Oh no, I guess I can't give her that credit. I thought it was her. So that's Elizabeth again. And now here's Mary. I thought she did mention nutritionist, but that was an earlier point that Marianne made. See, her darn on list so long, I almost tried to give that point to Elizabeth Warren. But once again, Marianne is winning this all the way around. Longer visits with doctors and their support staff to better equip patients with skills necessary to make lifestyle changes. Provide patients with more robust ongoing support from nutritionists, health coaches, therapists, mental health, exercise specialists, and other peripheral lifestyle treatment providers. Integrate world-class technology and system for better collaboration and cost savings amongst healthcare providers. Fund programs in our all educational system, pre-K through college, designed to teach nutrition and lifestyle skills to help cultivate long-term health. That would be immediately important, especially when you talk about diseases that could be preventive, such as, choices like obesity is from, overeating. And now, of course, 1 or 2% is from, thyroid issues, and stuff like that. But most obesity related issues is from, improper eating and stuff like that. So when you have nutritional based classes educating you early on, all of that can darn on, skirt, health issues from there, that can avoid diabetes altogether. Diabetes, blood clots, shortness of breath, having to get lap band surgery, then having to get skin removal, all that stuff that is associated with people who end up contracting obesity. All that can be avoided. And and the reason why I'm mentioning that is because America is the highest rated country in America for obesity. So educating people as soon as pre-K on the proper health care, we can drive down that obesity rate. So once again, another point for Marianne Williamson on the, programs teaching people early about nutritional. And also post-care, pre-K through college. So not only just K through 12, but we also go into secondary education as well. Restrict the marketing of overly processed and sugary foods to our children. Stop subsidies for agricultural production of unhealthy foods like high fructose corn syrup and hydrogenated fats, and incentivize and subsidize farmers, ranchers, and food companies for more healthy food production, making it more affordable availability. And let me get into high fructose corn syrup. Would y'all believe this is nearly in all your major commercial brands? And due to the monopolies that have been allowed in our country, Procter and Gamble, and owns nearly 90% of your foods, all your major brands and stuff. Your Fruit Loops, your Kellogg's, your Cookie Crisp, honey, that was my favorite cereal growing up. Your sodas, it don't matter whether you're under Pepsi, Dr. Pepper, Coca-Cola. Those are the 3 brands, and underneath them are like 3 dozen other brands. They are the ones that own, Sprite is a Coke-based product. Sierra Mist? That's a Pepsi-based product. And Mountain Dew, Sierra Mist is a Dr. Pepper-based product, and darn on Mountain Dew is a Pepsi-based product. So once again, Mellow Yellow is a Coke-based product. Sierra Mist is a Dr. Pepper product, and Mountain Dew is like a Pepsi-based product. And then you got all the other ones like your vitamin waters, and all of that falls underneath all of them. But some of these things have high fructose corn syrup, which interferes with your body's natural endocrine systems. It also does horrible habits on the darn on skin. And then the list of other things show it makes harder for your body to regulate its temperature properly. And the list just goes on and on and on of all the stuff that high fructose corn syrup does, from coating your darn intestines and your stomach, interfering with the breakdowns of your foods, preventing from the proper absorption of minerals and vitamins due to all that coating of the high fructose corn syrup in your body, and your natural acids are not being able to fully break that down in an efficient manner. over acidity in the body. Now, our insides are naturally meant to be acidic, contrary to the popular belief. I know people be like, Dr. Sabi, this, that, and the third, but on a medical note, certain parts of your body is meant to be acidic, and you don't want to be over alkaline in certain areas, because over alkalinity can actually lead to a leaky gut in certain cases. That's why you see vegans end up having a myriad of issues, because they over analyze, health conscious people like Dr. Sabi, which I love Dr. Sabi, by the way, but certain stuff is meant to be left to professionals who do this for a living. And when you think about, formulations, but that's another video within itself about, alkalinity and acidity. If y'all want me to do a video, I would do that on my main beauty channel, which I get into talking about medical aesthetics, health, nutrition, and all of that over there. But on this note, high fructose corn syrup does aid in disrupting the body in so many ways, but it's nearly in everything that we have that is sweet, like your little Debbie snacks, your syrup, your Auntie Mammy syrup and stuff, your pancake batters and all that. It's so much that this doggone thing is in. So that's why you need that's why you need literally a law passed to, get this stuff out. And that's why you see when you go to countries like Germany, you don't deal with as many health related issues just by them simply eliminating ingredients out their food. So that's how important, paying attention to ingredients are. That just eliminating certain ingredients out your diet. Now, even if you still eat snacks and stuff, if you eat more fresh based pastries and stuff that does not contain these chemicals, because I know some people are going to be like in the day, well, how come back in the day, and for my older folks who are watching, when you ate, pies and cakes and teas and stuff, you didn't have all these issues. But nowadays, when you eat pies, cakes, and snacks, you dealing with all these issues, because a lot of people want instant gratification. Instead of making tea from scratch like your grandma used to do, or like some of us still do today in the South, if you can't peep this North Carolinian accent, some people is getting that darn gone Lipton tea. And if you look at the back of the ingredient, I promise you, within the first 3 ingredients, high fructose corn syrup is on the Lipton tea. Nearly all your major teas that does not say that it's organic or natural, it tends to have this ingredient. Your bright and early orange juice, which a lot of people were fooled for many years because of the way that the FDA allowed for false deceptive advertising. A lot of people thought bright and early was orange juice because it has oranges on it and it's right beside orange juice. But turns out it has 0% juice value. It's completely nothing but darn gone chemicals. And the main ingredient was high fructose corn syrup. But a lot of people was believing that they was drinking orange juice. I don't know why, because bright and early has a whole different color than something that is natural. I can't think of a natural juice at the moment. What's the name of it? It's on the tip of my tongue, honey. Hold on, y'all. Okay, y'all, I'm back. I had to Google search it real quick, but Simply Orange Juice is a brand that is 100% natural, but right beside it is Bright and Early. And until the government made regulations saying that you have to disclose, the juice quality within your juices, because people didn't pay attention to the ingredients list. So people naturally took at face value that, okay, it's right next to a whole bunch of other orange juices, it must be orange juice. But come to find out that it had 0% juice quality. So now when you look at Bright and Early, if you turn the box over, it will tell you that in big bold letters that this is 0% juice. This does not have no orange juice content in it. It is just orange flavor. But a lot of people for many years was consuming that. And then when you came down with these health problems, you're wondering, why is it a health issue? When you come down with a cold, you're darn gone filling yourself with chemicals, thinking you're filling yourself with vitamin C. But when you look at the darn gone Bright and Early, it's not giving you no vitamin C compared to actual orange juice, Simply Delight, or if you was to squeeze your own oranges like yourself. So this is why your grandmother never had issues, because she was darn gonna squeeze her own orange juice. Your mother, she was going to the store, but she was getting the Simply darn on juice. But then by the time it came down to like the Gen Xers and Gen Ys and now Gen Zs, we darn gonna getting the wrong juices. And then don't even get me started with the Kool-Aid man and all that. And then, once again, my community, we not only is we getting the Kool-Aid man, but then we darn gonna putting the darn gone whole bag of sugar up in there. And then we wondering why we having diabetes and all this, acne skin, you're overproducing of oils, hair not fully growing to its optimal potential. And the list goes on and on. And Marianne Williamson's comprehensive policies is going to get into discussing all of that. It targets all of those points of the corruption that our government has allowed, just by way of, allowing certain ingredients like high fructose corn syrup to be around, hydrogenated fats, and incentivizing and subsidizing farmers' ranch. But she goes to talk about subsidizing farmers, ranchers, and food companies for more healthy food production, making it more affordable and available. This is what we need. This is why I love Marianne Williamson. Anita darn Bernie nor Elizabeth Warren mentioned either of those darn things. And we just on policy number darn 7. Now going into policy number 8. Shape food policies using cutting-edge public health science instead of following the lead of lobbyists for industries whose sole focus is profit. Secure and expand the role of EPA and FDA to keep toxins out of our environment and our food supplies. Take a national look at stress levels and develop ways to lower stress societally. That means is adding vacation time, protecting a manageable work week, and taking a close look at how our electronic devices impact our lives, just as the FDA is supposed to make recommendations about how we eat. The FDA should study and make constructive recommendations on how we consume data from our phones and devices. And guess what? All these technologies right here are omitting darn on smogs and stuff. And I used to be part of a company which, unfortunately, the system structure of the technology, was overpriced for the everyday person. Eventually, Apple ended up making it. Well, Apple's darn on expensive too. So it's like the modality that was patented under Fitbit, end up going to Apple, and that business went under. But they used to sell something that you can put on the back of your phones that will alleviate the electrosmog that they call it, which is the electromagnetic waves that come out all your electronics. And it does affect us, and can, overexposure can lead to, memory issues and the development of tumors if we're not careful. That's why so many people was wary of 5G technology at first. But all of that can be avoided with the technology that came out underneath that company, which it was a sticker that blocked the waves, so you can just put it on the back of your phone, you can put it on your laptop, you can put it on the back of your TV, your phone, your Wi-Fi modem, and all that, even your baby monitor. Imagine your baby ain't but 2 weeks old, and the electrosmog technology is already permeating to your child's brain. But you're not thinking about that. You're thinking, for safety reasons, let me have this monitoring device to make sure my baby's okay. The baby don't accidentally suffocate itself in the crib. The cat don't accidentally jump in. For y'all that got pets. All that. But we don't think about those types of issues. So once again, another thing that I love about Marianne Williamson addressing that, and that she's made aware of, and I'm going to leave that company down below. Like I said, the company ultimately went under, but you can still go to Amazon and find, the things to put on the back of your phone. They average between $29 to $34 per thing. So keep that in mind. Very costly, but the thought of what it's doing and preventing the electro smalls from getting to your brain and all that is worth every bit of the money. If we can make stuff like that more affordable, and then they had a plan to come out with phones that was already integrated with that technology, which I think since iPhone brought them out, Apple brought them out, they might start infusing that in their iPhones where, it is infused with with that type of technology where it prevents the electromagnetic waves from getting to your brain and all that, so you don't have to worry about that, because it interrupts your sleep patterns. And once again, you can get developments of tumors in your brain, all from the electromagnetic waves and stuff go around us on a daily basis, from our phones we can't be separated from people like me having to do hour-long videos on YouTube with my laptop, and then with me doggone being a TV junkie. If I can, once I get back to work, I'm going to get those little stickers and do a review on them on this channel, and then I'm going to show y'all the difference. I mean, it's hard to show y'all the difference of how it'll affect me, but you'll probably see that I'll be a lot more energetic, because people who are also surrounded by a lot of technology, it also drains you in a way as well. But I notice when I'm not around technology, and it's not even about me being on it, just with it being on in my presence, I notice that it affects my body. Because whenever we have power outages in North Carolina and we are out of power and I'm just outside, my whole body feels different. Even if I'm still within the house and no technology is on, I can feel a difference within my body. So she is really talking on some serious stuff about the way, the data and stuff affects us, not just mentally, but physically. So I definitely believe Marianne Williamson is the best president to talk about these issues. Nobody else is mentioning stuff like this in such intricate details. I mean, it's fascinating that Marianne Williamson does it, but it's sad at the same time that hardly nobody else does it, or so we thought, because we have yet to go to Andrew Yang. So, Yang gang, I still got y'all. But then she goes into policy numero uns, which is 11. We need to develop healthy habits at a community level. Towns and cities can and should look collectively at how active their populations are and institute more ways to increase physical activity through walking paths, bike paths, and community events. The diet of entire cities should be reviewed, as well as ways that communities can contribute to one another's daily health. The Consumer Financial Protection Bureau should investigate how hospitals overcharge patients, and the Justice Department and Antitrust Division should explore ways to remove as much of the profit motive out of medicine as we can. The Center for Disease Control should invest more research into preventing diseases rather than treating the symptoms, and look broadly at vulnerabilities in the systems, like avoiding pandemics by encouraging healthy disease avoidance behaviors. The Center for Disease Control should invest more research into preventing diseases rather than treating symptoms, and looking broadly at vulnerability in the systems, like avoiding. Okay, I just said that. And I know y'all going to say, well, Bernie said that, but this is all that Bernie said. Look at all the other policies that we don't mention with in regards to Marianne Williamson. And Bernie, this is the only thing that was somewhat similar, but this was on Marianne Williamson policy from the beginning versus Bernie's. He done updated Medicare for All plan, because I can tell you that him mentioning this was not on it the last time. They been looking at my little videos on the low, and they been updating their policies accordingly, which I definitely recommend they do. Because I'm not, because this is what it's about when it runs for presidency. If somebody can learn from another candidate's, policy and update theirs accordingly, I definitely encourage that. We seen that for even Marianne Williamson herself. So, and vice versa, because I'm going to get into Andrew Yang and Marianne Williamson's connection in a moment, but I seen that they've been, exchanging ideas that I wasn't even made aware of until recently. So it's good for them to exchange ideas and stuff. But if we're going to give credit where credit's due, who's been most consistent with it, and Marianne Williamson has been consistent with this since day one. So 14, we also need to find non-pharmacological ways to treat mental health issues and to take all mental health issues as seriously as physical issues and reduce the stigma of mental health illnesses so that more will seek and receive treatment. We need to treat drug addiction as a mental health issue and not as a legal activity. Only by decriminalizing drugs can we break the backs of cartels and drug dealers while getting addicts into recovery. I love how she just says drugs, and that opens up the door for all drugs versus when Bernie and Warren mentions it, they specifically say opiates. And the reason why it's opiates is I'm going to go there with the racial card. Opiates is affected mostly white people versus crack is affected mostly black people. So when you say you're going to target the opiate epidemic, yes, some black people have been on heroin or heroin, however you pronounce it. But most black people were affected with crack cocaine. And when the crack epidemic happened, we were targeted. We were called super predators. We were, we got the 3 strikes law. We were put in jail for, extremely long periods of time. But now when white people are at the same levels, actually worse off than when black people, because you still had the working, functioning crackhead. We even had successful crackheads, i.e. Whitney Houston. You even had some of your doctors who was caught up in the system and still managed to do stuff. Hell, they tried to accuse Mariah on Married to Medicine of being a crackhead. But honey, she ain't that bad off if she darn managed to create a whole platform for all y'all heifers to be on to talk shit about her. So even when black people end up getting put out on crack cocaine, some of our darn addicts still manage to thrive. But unfortunately, the white people who are suffering on heroin is not doing the same thing. So not only is we, decriminalizing it, but we going as far as to make sanctuary cities, which okay. But the thing is, let's treat everybody fairly. We can't darn treat one person on one drug one way and then treat another person on another drug a different way. So I love how Marianne Williamson is talking about decriminalizing all drugs as opposed to just talking about opiates. When people talk about opiates, that's code for, okay, we're going to focus mostly on the drugs that white people are far more primitive to. But when we talk about crack cocaine, honey, you don't hear a peep out of darn Bernie nor darn Elizabeth Warren like that. Now, Cory Booker has been very vocal on it, but once again, he's struggling to try to get on the debate stage, like Marianne Williamson. The people who darn mentions the crack cocaine, you notice, ain't been able to get on the debate stage. Once again, we got to be fair when it comes to this darn treating drugs. We always want to talk about opiates, but darn opiates ain't the only drugs. And for y'all to think, crack and opiate, I mentioned in the last video. For y'all that don't follow my entertainment videos, opiate is a darn sedative like drug, and crack is a stimulant. They in 2 complete different families. So don't tell me, oh well, opiates include, crack. No, it don't. Opiate is not. Crack is not even classified under the opiate epidemic, under the opiate category. They act 2 totally different ways. They affect your body in 2 totally different ways. But once again, if y'all want to listen to a little bit of TV talk commentary, I get into also mentioning about those differences within that. That was my last video, so feel free to check that out if y'all want to also get into a little bit of TV talk with Married to Medicine, my soap operas and all of that. I end up describing the differences between crack cocaine and heroin and how it affects the body. So the last one is, that was the last one, at least in that paragraph, because now we're going into the last thing right here. This is how a mature debate begins on the issue of healthcare. As with most issues, the underlying problems is the corporate dominance of American governmental policies. With Marianne Williamson in the White House, Americans will be well aware that on a daily basis, their president is working to realign government policies with the health and well-being of the American people. Come on through, Marianne. That's where it's at. No need to even go more. You see before your own eyes why I am Team Marianne Williamson all the way. And once again, y'all know this bipolar weather. It's now 30-some degrees. It was darn on 70 the other day. Now it's back to darn on 30. Girl can't never darn on stop darn on with these sniffles. Once again, if I get back into stable income, which is once again why I like Andrew Yang, we're gonna get you. Yang Gang, we coming to y'all. Between Marianne and darn on Andrew Yang, I can finally get these darn on sniffles and my low immune system together. Darn on the government won't be darn on, profiting off a sickness industry. And then we can get darn on Medicare for all and also preventative cares and stuff, treating people with Crohn's disease. And once again, another thing that Marianne Williamson tackled on is about changing our outdated food pyramid. And why is that important? Once again, dairy is recommended on the food pyramid, but a majority of people in the world have an intolerance to dairy. But due to the way that it's educated to us in school, we are believed that dairy is meant to be healthy for us, even though we can get those same nutrients from plant-based sources. But we're taught that we need it from the cow instead, or maybe the goat. And then when we come down with contracting these illnesses and perpetuating the problems, increasing mucus development in us from Crohn's disease. I nearly died in my senior year of high school, not only from cancer, but after I got in remission, I was still darn on weak. I was still fragile, but I was drinking a gallon of milk a day. And then come to find out after I end up consulting with a specialist, I think it's what's the specialist? Is it an endocrinologist? That deals with hormone disorder, because my hormone levels was out of whack. In addition, so I think it was an endocrinologist in addition to another specialist. And I'm dealing with everybody. I'm dealing with the gastroenterologist, my primary care practitioner, my oncologist. So it's like I'm trying to remember all these different titles while also trying to go to school, do my senior project, in addition to trying to have a normal senior life. So it's like, but yeah, it was a doctor that ended up running the test and all that, and come to find out it was the milk that was killing me. I had to immediately give up milk, and I have not had milk in over 8 years. 8 years I have been completely free of milk, and that has changed me alone. Because I was getting my most severe chronic flare-ups that was putting me in the hospital due to the milk, but nobody never knew why. And then, me thinking that, okay, the milk is, we are taught milk is healthy for us. So I'm steady drinking more and more milk. And then it's the milk all along that was killing me. And then we're taught that, you just got an intolerance. But that's really a fallacy, because a majority of black people have an intolerance. And when a majority of the people have an intolerance, is it much as an intolerance, or is it the people who can accept it is in the minority category? So black people, 74% of us on average have an intolerance. Native Americans between 70 to 75, Asians about 72%, Hispanics 55%. White people are the only people where 2/3 of people can tolerate dairy products. 1 out of every 3 white people have an intolerance to dairy products in America. And because a majority of white people in America, who represent 60% of the population, can digest milk, it's seen as an intolerance with everybody else. But globally, brown and black people represent over 90% of the world population. So it goes to show that realistically, it is more abnormal to be able to accept, dairy products, as opposed to not being able to accept it. So the people who can accept dairy products without any issues is ones that have the abnormality, as opposed to the people who cannot tolerate it. So we need to flip that narrative of people saying that I'm lactose intolerant, because the majority of the people in the world are lactose intolerant because we're not naturally designed to even digest dairy products from an animal. But once again, it was taught in school that it was healthy for us, that 2/3 of our servings should come from dairy-based products. And now you wonder why we're so sick, and the government profits off of our sickness. And thus, back to Marianne Williamson's point, that the government, by systematic design from birth, is set up where it keeps you going to the hospital. So Bernie Sanders' plan, which just shifted from, okay, you're no longer paying as much out of pocket, but now the government's going to flip the bill. The government's going to keep flipping the bill because Bernie and Bernie and Elizabeth Warren don't address, these problems at the root cause. Marianne Williamson not only addresses universal health care, but she also addresses these problems at the root cause. And it is very critical to people like me and saving people like me's lives. From people who have Crohn's disease, from people who nearly died from drinking milk, and we're darn gone programmed to think it's healthy for us. So when people say that Marianne Williamson is just doing too much, I say, honey, she's doing more than enough. She is going above and beyond and darn gone not only educating the people, but deprogramming us of these stigmas, because we have been conditioned to believe these darn gone false narratives to this day about dairy products, about, just drinks and snacks and stuff, in moderate. No. We should not be consuming no type of high fructose corn syrup, to be honest with you. Which is why I'm for getting rid of high fructose corn syrup out of any darn product in America. And then once again, funding the treatment and the cure for certain diseases. Not just funding treatments, but the cures. So I give Bernie Sanders credit for talking about trying to find medications for cures for diseases. But guess what, Bernie? You know damn well you the oldest person running. You and Joe Biden are the oldest candidates running. You old enough to know that there are already cures out there. What you talking about? They're gonna try to fund cures? They already out there. Doctors have been summoned to court because they were sued for lying about coming out with cures for darn gone HIV and cancer and stuff. And then when they showcase their medical files proving that, well, I done managed to cure so many people of my that have come to see me. I have had 50 patients in remission. Ain't never had nothing again. I've had over 200 patients that I managed to get rid of their HIV. I've done had somebody who had stage 4 cancer. They went through my treatment, didn't have to go through no chemotherapy, and they went from stage 4 to now being in full out remission. But then when I try to push this towards the government, they want to blacklist it. Then they want to price it where it's a ridiculous cost where the average person cannot darn on go through the trials and stuff. It's on the darn on person to darn on try to come up with $1 billion just for the government to test it out. But you're talking about something that can cure millions of people. Once again, you would think that the government be willing to pay you $1 billion. The darn going, if you darn gonna come out with something. We're so backwards. But it's done by systematic design. You would think a government that is as sick as we are as people, who have the highest level of obesity, we have whole towns that have HIV that is similar to a third world country, i.e. Atlanta, Georgia, i.e. Tennessee, i.e. Louisiana. People just stereotype Atlanta because it's the most highly concentrated of LGBTs. But guess what? Atlanta actually went down, boo-boo. Let me go ahead and clock you these doggone HIV statistical facts. HIV used to be the highest in Atlanta, but guess what? Currently, the stats show that Atlanta is down to number 7. I think Tennessee, baby, country Tennessee, is darn gone number 1 in HIV. Louisiana, I think y'all are also is still in the top 10. So, with that being said, Shouldn't we also be trying to, find those doctors who were able to have long lists of darn on patients that they got rid of HIV? Shouldn't we darn gonna be paying them and darn gonna helping, fund this on a national level? But we don't hear about that though. We hear about, let's darn gonna push Truvada. And then later on, it become one of the upteenth darn on medications on your darn on TV screen talking about, if you have taken Truvada, you are entitled to compensation. So you darn gonna come out with this watered down darn on medication that is overcost, that if Bernie Sanders have it his way, he's gonna make it affordable for you. He's gonna make it where you no longer have to come out $2,000 out of pocket. You might only come out $200. But Marianne Williamson would go a step further and make it where we darn gonna fund the cure for HIV instead, and that way you don't even have to worry about darn gonna costs. So once again, which one makes more sense? If I have HIV/AIDS under Bernie Sanders, you're gonna make it more affordable for me to get my pills, but under Marianne Williamson, she'll make it affordable for the time being that I have it, but we're also going to simultaneously come up with the cures that have already been in development. And once again, this is why I am Team Marianne Williamson all day. This is why I stand for Marianne Williamson. This is why I am always so passionate when it comes to Marianne Williamson over Bernie Sanders and Elizabeth Warren. The plans do not compare. Marianne Williamson is in a league of her own. But let's now go on to Andrew Yang, because he finally came out with his Medicare for All plan, and it shocked me. Because it was quite similar to darn on who we just got finished praising. But let's get on into it so y'all can see the receipts for yourselves. A new way forward for healthcare in America. Okay, y'all still with me, y'all? If y'all praise to everybody who managed to watch this video all the way, because I think this is about to match my longest video that I just did the other week. I've been on YouTube for going on 8 years. And my first multi-hour video was late last year just around Christmas time. So we might actually this might be the second video that comes at the 2-hour mark. We'll see. So a new way forward for healthcare in America. We are having the wrong conversation on healthcare. Instead of addressing the underlying problems driving unaffordability and access, we Democrats are spending all our time arguing over who is the most zealous and wanting to cover Americans, over who has wanted to do so longer, over who care more about the health of Americans. We talk about how we're going to pay for it, but the reality is we're already paying for it. We pay for it when we can't switch jobs. We pay for it when new jobs are temp or gigs that don't provide health care. We pay for it when all of our prices are higher. We pay for it when healthcare costs drive us into bankruptcy. To be clear, I support the spirit of Medicare for All, and have since the first day of the campaign. I do believe that swiftly reformatting 18% of our economy and eliminating private insurance for millions of Americans is not a realistic strategy. I definitely agree with you on that, Mr. Yang. So we need to provide a new way forward on healthcare for all Americans. Okay, let's see what you got. As Democrats, we all believe in healthcare as a human right. We all want to make sure that there is universal affordable coverage. We know we have broken healthcare system where Americans spend more money on healthcare to worse results, but we are spending too much time fighting over the differences between Medicare for all who want it, and ACA expansion, when we should be focusing on the biggest problems that are driving up costs and taking lives. We need to be laser focused on how to bring the cost of coverage down by solving the root problems plaguing the American healthcare system. Okay, now this sounded interesting at first. When he said we need to be laser focused on the root cause, then I thought he was going to be on some, the sickness like Marianne Williamson and really talk about it. But this is where it takes a turn for, not so good. That means controlling the cost of prescription drugs. Okay, we on the surface level. Yes, we need to get the cost down. I'm here with you on that. That means investing in innovative technology to cut and waste and boost access. That means changing the incentive structure for providers. That means shifting our focus on more stages of care. That means revamping what comprehensive care means in the 21st century to include crucial aspects of well-being. That means taking on the powerful lobbyists in DC. I was here with Yang on this. Diagnosing and addressing these underlying problems is the first and most important step to ensure everyone has accessible health care, because we cannot extend quality coverage to everyone without real strategies on how to avoid the toxic incentives of our current system. We can't afford to mess this up. Fundamentally, we need to have a more producive conversation about healthcare in America. It's time to take a step back from enrollment mechanisms and creative accountings to focus on lower costs and improving quality. Then he got some points too, not as much necessarily as Marianne. Marianne, we had like 15. Andrew Yang is going to give us a solid 6. So we need to fix our broken healthcare system by tackling the root problems through six-prong approach. And once again, here we go. Numero uno. Control the cost of life-saving prescription drugs. Okay, that's where all of them are in agreement on that. We all got the price negotiations down for everybody. Through negotiating drug prices using international referencing prices, forced licenses, public manufacturing facility, and importation. So point to Bernie Sanders, because Bernie Sanders was the only one out of all 4 candidates that mentioned the Pacific countries, which were the best to negotiate prices with. I will give Bernie Sanders credit where Bernie Sanders is due. So to the Bernie supporters, don't say that I'm biased against him. I do be fair with my commentary. Number 2, invest in technologies to finally make health services function effectively and reduce waste by utilizing modernized services like telehealth and assertive technology supported by the measures such as multi-state licenses laws. Number 3, change the incentive structure by offering flexibility to providers, prioritizing patients over paperwork, and increasing the supply of practices. 4, shift our focus and education ourselves in preventative care, end of life care options. 5, ensure crucial aspect of well-being, including mental health care for people with disabilities, HIV/AIDS detection and treatment, reproductive health, maternal care, dental, and vision are addressed and integrated into comprehensive health care for the 21st century. 6, diminish the influence of lobbyists and special interests in the healthcare industry that make it nearly impossible to draft and pass meaningful healthcare reform. So at no point did we get into, the economy, is what thrives off of our sickness. He touches on it, but very surface level. This is no more than what Bernie is giving us. This is no more than what Elizabeth Warren is giving us. But he does go into mentioning certain unique structures such as telehealth. That was unique to Andrew Yang. And then change the incentive structure of doctors. But he goes into further, explaining that below. So why do prescription drugs in the country cost so much? Industrial drug change prices at the whim of those running the pharmaceutical companies. Brand name prescription drug prices have risen 76% over 6 years, and they're not slowing down. Patent trolls or non-operating companies that extract cash settlements from companies they accuse of patent infringement can drive the prices of certain medications up while providing no value themselves to the U.S. healthcare system. And while drug companies complain constantly about the high cost of research, they fail to mention that almost all FDA-approved drugs over the past several years relied on basic research funded by the National Institute of Health. They also don't mention the record high profits that they've been experienced in recent years, while drug companies bring in only 23% of healthcare U.S. revenue. They make 63% of the total profit. In 2017, Purdue Pharma alone earned more than $35 billion from OxyContin sales. Come on with the Pacific facts, but then again, he is the Asian runner, and sure enough to Asian stereotypes, honey, they are some darn smart, driven people. They darn break down the numbers. Come on through, Yang Gang, honey. Give us the darn numbers. Team math, honey. Make America think harder. Honey, I was a C average student when it came to math, so I'm here for this little bit of math, knowledge with the Pacifics, with the dollar amount. Come on through, Yang Gang. It makes it impossible for Americans who need drugs to afford their treatment. Many are choosing between their medicine and food or shelter. The runaway growth in drug prices since the turn of the century has led the U.S. per capita spending on pharmaceuticals to exceed $1,000 a year, hundreds more than our peers in France, Germany, or United Kingdom. Okay, second thought, I stand corrected. Andrew Yang is the second candidate to mention certain countries by name. Now, he didn't mention Canada, though. Now, Bernie still keeps the point because he mentioned Canada in addition to United Kingdom, Germany, and France. But I do give partial credit to Andrew Yang for mentioning these drugs right here. We need to put pressure on these companies to get their prices under control and more in line with the rest of the world. Americans pay twice as much as Australians and 3 times as much as the Dutch on prescription drugs due to lack of price control, amongst other things, honey, that Marianne Williamson tapped into. We have to give the federal government authority to negotiate drug prices and use standard international price reference points so pharmaceutical companies can no longer exploit our market and the American people. If these companies are not willing to compromise, we need to ensure the U.S. government has the ability to force licenses for these drugs to companies who will. Additionally, we need to authorize the creation of public manufacturing facilities to make these drugs as well as other necessity drugs and unprofitable but necessary medications for the American people. If all else fails, we need to allow the importation of medications from other countries. As president, I will work with the Congress to pass a law to negotiate drug prices, use interpretational reference pricing to set a baseline, and allow for forced licenses of medications if companies can't come to a reasonable agreement with the federal government on costs in line with international prices, create public manufacturing facilities, produce generic drugs, and produce drugs through a forced license to cost at a minimum, also manufacture unprofitable medications and import high demand medications. Now, this is where it gets a little bit problematic because I hope those companies are also producing some profitable medications to keep the lights on. Because once again, if we're talking about producing medications that don't have absolutely no profit motive, then the government has to be at least providing the bills to that office to keep the lights on if they're providing vital medication. You can't have an independent company produce, drugs for free and not, have an up price to, cover the basic costs. Because at the end of the day, a profit margin is key in certain instances to pay the inventor, and it's not to the tune of millions and millions of dollars. That's when it starts to get corrupt. But, you still got to pay the average day working man in those factories. From the people, even though it's pressed out by machines, you still got people that have to oversee the machines and stuff. People have to overlook the labelings and stuff of the bottles and all of that. We have to make sure all of those people are properly getting paid a decent wage. And so I don't mind that certain medications are produced at a higher cost than what it costs to make, because I factor all of that in from a marketer's perspective, that, the lights got to be paid, in the custom, the employees got to be paid as well. Also, if they're working 40 hours a week, the insurance payments for them have to be also provided for as well. So, yeah, you got to have a profit motive, but it don't have to be over 50 times, 100 times, 200 times the original cost of medication. So, I think, allow a profit motive, but it shouldn't necessarily exceed 10 to 20 times the cost of what it costs to make for the drug. Just my humble opinion. Sorry for that notification, y'all. I got my darn on thing on. So continuing on, if all of the above fail, allow for the importation of prescription drugs from other countries. Then it goes into number 2, invest in innovative technology. Can innovation help reduce healthcare costs? The advancement of health and communication technology has the potential to increase access to care while reducing overhead. We should invest in expanding existing technologies to reach those in underserved areas, especially the 77% of rural countries that are considered rural primary care deserts, 9% of which have no physicians at all. Once again, the specific numbers that no other candidate that has, like he goes into not only mention about the rural areas, but the exact percentages. With greater telehealth infrastructure, we can help nurse practitioners and other health professionals provide a higher level of care under the digital supervision of a doctor. By harnessing the power of technology, we can ensure the healthcare system functions more efficiently and effectively. Utilizing telehealth to meet provider demands. Demand for physicians is outpacing the availability of supply, and the shortage is causing problems for the nation's growing and Asian population. Telehealth is an effective approach for doctors across the country to provide care for patients in rural and underserved areas over the internet without needing a specific redundant license to practice medicine in the patient's state. Utilizing telehealth will enhance the quality of life and reduce hospital visits while curbing deaths from chronic diseases. Patients will be able to access treatments that may not be conveniently located. About 62% of rural countries are not equipped to provide services such as diabetes, self-management, education, and support, DSMES for short. Numerous case studies have illustrated the benefits of telehealth for DSMES so far. For example, once a rural clinic in Montana implemented it, 61% of participants began monitoring their blood sugar accurately after just 6 months, an improvement from 31% pre-telehealth. The services also shown positive results for mental health, stroke treatment, cardiac rehabilitation, and cancer treatment. Medication abortions have similar efficacy of terminating early pregnancies as in-person abortions. Enlarge the geographical footprints of medical providers through telehealth can improve access to abortions in the 27 U.S. cities with populations greater than 50,000 people that have no abortion clinics within 100 miles. Telehealth is cost-effective alternative to the more traditional face-to-face way of providing medical care and has the potential to save billions annually while improving health care related to strokes, cardiac services, diabetes, and epilepsy. Ensuring health care for all. And you know what? If this was around, this could have saved my darn last job. Because I did not have no darn neurologists at an affordable rate within my area, and that's what caused me my last job. Is I had a grand mal seizure on my job, and I talk about that on my business channel. So subscribe to my business channel, D1 Business, below to learn more about that. But yeah, that caused me my darn job, and I couldn't consult with a neurologist to get an in-depth darn thing. Now, granted, there was some other stuff going on with the job that asked me out. I did get cleared by a doctor nonetheless, but they was not accepting my darn doctor's note, and drama with that, but I digress. But if I definitely had access to a neurologist within my city and I was able to get to them, they damn sure would have had a far harder time trying to darn kick me out of that particular job that I was at. But anyways, Andrew Yang goes further to say ensuring healthcare for all also requires federal regulations of telehealth and expanding it in a way where we can distribute service and treatment. As president, I will encourage the use of telehealth in rural areas and for mental health services. Invest in the use of telehealth in rural areas, including ensuring broadband access to 99.9% of Americans. Come on through, Yang Gang. Allow licensed physicians to administer medical services and medications through telehealth services. Assisted technology to boost coverage. As we continue to invest in medical innovation, we must integrate assisted technology into primary care provided by doctors and nurses. Existing technologies like telehealth and emerging technology like medical OWL must be leveraged to expand care. Working together through telemedicine, teams of nurses, OWL, and doctors will be able to provide care to thousands of Americans that currently have limited access to health care. As this technology advances, we need to trust in our nurses and nurse practitioners to provide care that historically the responsibility of MDs. This will be essential in providing access to care across rural areas and can even be supervised by a doctor through a telehealth system. This new system, combining the best of OWL, telehealth, and professional expertise, will allow for a more flexible, responsible healthcare force without sacrificing quality of care. As president, I will invest in the development and deployment of medical technologies in rural areas to assist nurses, practitioners, other professionals, and administer vital care in areas where an MD is not physically present. Multi-state licenses and federal registration for physicians. Now, this is a unique one. Point for darn Andrew Yang for this one, because I never understood why, we still limit this to states. Like, why can't it be a ultimate doctor program that gives you a license to practice across any state lines? Now, I understand certain states are more laissez-faire than others, but I do believe if you have one federal, program where it's the highest amongst any state by default, you should be able to practice in any state if you have the highest level of, doctorate training. So I would love for a law like that to come out for doctors. That way you can get to practice across state lines without having to have a license in every single state. You can have one large federal license that recognizes you all across the 50 continental United States. But this one allows for multi-state licenses and federal registration for physicians. Human anatomy doesn't change across state lines. Speak on it. But doctors are still required to obtain medical licenses for each state they practice in. Honey, about the same thing with us estheticians, but that's another video. Like, understandably, like Florida, they only had to have 250 hours. We had to have 600, but my school, we did 720 hours of aesthetics. Georgia is 1,000 hours. I believe if we had the highest level of training across all the states, I should be able to practice under one license no matter what state I go, and it should read federal. And so it should go down to the dermatology industry and aesthetics as well, not just doctors. That's my biased opinion on that. But he goes on to talk about we must streamline the licensing system and introduce a single comprehensive telemedicine license that, once granted, will allow care providers to see patients in all 50 states. Once again, this will set the precedent for it to go down to the dermatology industry and then go down to the medical aesthetic industry, which I will be here for, honey. Allow me to help service my darn people who always ask me about skincare advice across all 50 continental states. Now, I can sell across all of America. I just can't darn treat people. Like, if I was to hop on a plane and go to Texas or Alabama, Louisiana, Mississippi, Tennessee, honey, I got to have a license in each and every one of those states. And that's just ridiculous. The cost of that, oh no. And then it's like you got to pay a separate cost. You just can't pay it all at one whop. You got to pay each individual. So all those transactions when you could just pay one lump sum darn fee for a federal license, I'd rather have that instead. But that's a whole nother video discussion within itself. Federal regulations of medical licenses will remove friction and encourage doctors to start participating telemedicine and make inroads into primary care deserts. As president, I will implement federal regulations over telehealth, implement federal medical licenses to physicians to practice telehealth across state lines. Honey, that's a unique point to Andrew Yang. I'm going to give him that one. Then number 3, I told y'all, this is going to be my second video that's multi-hour long. I hope y'all got y'all snacks, because This look like it's going to be long too, y'all. How do we improve the economic incentives of our healthcare system? Like any other industry in the country, the healthcare system in America has evolved into the mess that it is today because the incentive structure allowed it to do so. So let's change it. We can rebuild and modernize the electronic health record to minimize the hours doctors spend on administrative tasks. This way we can get doctors back to seeing patients and spending less time on computer screens. Let's move to a system that incentivizes maximizing health instead of administrative activity. Let's free up practitioners to focus on doing their jobs unencumbered by administrative and unaligned incentives. Transition to a 21st century payment model. Most doctors are still compensated through a fee-for-service model. This model pays doctors according to how many services they prescribe and thus incentivizes them to do unnecessary tests and procedures. This model wastes hundreds of billions of dollars every year to get these wild costs under control. We should follow the lead of the Cleveland Clinic and the Mayo Clinic and help transition doctors to onto a salary model. I'm definitely here for that. Also, they probably encourage the reduction of all those unnecessary but I ain't gonna start up that controversy with vaccines. But it's like, even if you done had some, they try to stick you with 20. You went in for one, and then they try to stick you for 20 under that they pay for the amount of vaccines you get. Oh, well, this is a new one though. You might have just went and got one at the pharmacy, but this is a new strain. I came in for one, honey. Now here you go trying to give me a blend, and then they try to stick you all with. Then another trick is they have one that has like 20 different variations all mixed into one, like a big old cocktail, honey. So you think you just got one shot, but it was like 20 different medications within that one shot. All that tricky stuff that they do. So I believe that the salary model would help a lot of doctors to stop that as well. Now, of course, there's still some backdoor corruption, and that's another video for another day. But then he goes on to mention about we can to give hospitals the physical freedom they need to transition doctors to a salary model. We should explore the captive payment model. This would mean the hospitals could receive lump sums based on their patients' intake instead of using complicated fee-for-service arrangements. I'm definitely here for it. Once again, another point to the Yang game. Any capitation payments would be responsible, calibrated to ensure the doctors aren't forced to see more patients than they can handle, and low intake rural hospitals receive enough funds to cover their operating costs. A model in which hospitals are paid through capitation and in turn pay physicians on a salary aligned in incentives so that patients' care and compensation are on the same side. Doctors will be paid for providing great patient care, not for prescribing them unnecessary tests and procedures. This would allow doctors to focus on a patient's health in the most effective way instead of the most expensive. This performance-based payment system incentivizes physicians to consider best practices for providing quality preventative health. It is not only cheaper to take care of a healthy person rather than treat an ill person, it keeps people healthier by ensuring that they see a doctor for their illness rather than self-diagnosing, risking negative consequences from proper treatment. As president, once again, this is where he goes into reiterating what he said above. Move away from defensive medicine. Doctors operate under a constant threat of malpractice suit. These cases are only decided by a verdict 5% of the time, and when they land in the doctor's favor 80% of the time, despite the fact that doctors almost always exonerated. Malpractice suits can take years. As a result, doctors often prescribe needless procedures and tests to avoid being sued. We need to allow doctors to practice medicine that prioritizes a patient's health without legal fear in the back of their minds. In order to do this, we must reform the bloated tort system that takes up a larger percentage of GDP in the U.S. than other developed countries. As president, I will discourage doctors from practicing defensive medicine by making them less vulnerable to frivolous malpractice lawsuits and providing institutional support to doctors, resulting in an increase in time spent with patients. Now, sometimes a malpractice suit is warranted. Some of these doctors be sloppy out here, so we got to be careful with that one. Decrease administrative rates. Today, doctors spend 2 hours long doing paperwork. And this basically goes into him talking about how he would go into changing that. It will also reduce the high doctor burnout rate that costs HealthCare $4.6 billion every year. And y'all know, at time's sake, now I'm getting to the point where I'm glossing over certain things. I stay consistent to this point, so I'm not cheating y'all. Yang, he's another one who got a long, lengthy list, so I can afford to cut some corners where he's repeating in certain areas. Because now I'm starting to lean down and my nose steady running with this darn fan on so my neighbors don't hear me. Y'all know these walls are thin as all get out, honey. Increase availability of primary care. In order for everyone to receive primary preventive care, we need more doctors. We currently have a shortage of doctors, and the problem is only going to get worse if we don't make some changes. The astronomical cost of medical school is also desensitive because becoming a lower paid primary care doctor does not make sense for medical students with hundreds of thousands of dollars in debt. He's really speaking facts. We must take immediate steps to expand loan forgiveness programs for medical students who choose to become primary care or family doctors. This will help grow the primary care workforce. America has plenty of smart kids capable of being doctors, but not enough spots in school to train them. We must stop artificially restricting the amount of doctors we train and start expanding medical schools. See, now under Marianne Williamson presidency, we wouldn't have this issue because if you treat the root cause of why people are getting sick in the first place, by default, a lot more people are healthier, and then you would just have to go to your primary care for, physicians for checkups, prenatal care and stuff like that. Just general stuff as opposed to more serious stuff. And by default, you wouldn't have the lack of supply and demand for the doctors. Because in a perfect world, we want to get to the point where going to the doctor becomes more scarcity. You just want to go for general checkups and for pregnancy and stuff like that, as opposed to for more dire issues. And that's why, once again, Marianne Williamson still reigns supreme. But this is why I say both of them would do good under scientific, because with him having these numbers and specifics and coming out with, the telehealth program, the salary-based model, it directly complements Marianne Williamson. That's why I say if I had to choose between Bernie Sanders and Elizabeth Warren versus Team Marianne Williamson and Andrew Yang, honey, they got it for the win right here. Because even though Andrew Yang, he tried to, get out of doing Medicare for all together, which is a point down from him, but still he's providing so many specifics where if he teams up with Marianne Williamson, they easily overpower darn Bernie Sanders and Elizabeth Warren, honey. Because it goes into stating we must take immediate steps to expand loan forgiveness. Then it goes into to increase primary care. We must also look to our nation's 3 million nurses and 207,000 nurse practitioners. These professionals are trained and qualified to provide critical care to services, but are banned from providing them due to restrictive regulations. Our nation should follow the example of the state like Virginia, which passed a bill that allows seasoned nurse practitioners to open up their own practices to provide medical care to their communities. Responsible deregulation can open up our medical system and connect more patients to primary care. As president, I will lift the regulations regulations and funding caps that currently limit medical residents and other health professionals from entering the medical field, providing loan forgiveness programs for doctors who go into general practices, especially in rural areas, work to expand medical schools that focus on primary care. Another point for Andrew Yang on this. And then he goes into shift the focus on care. And this when he started sounding a little bit more like Marianne Williamson on here with talking about the preventative care. So, can shifting our food costs reduce health? Preventative care is critical in managing our nation's health, whether that means going for an annual physical exam, eating healthier food, quitting smoking, exercising regularly. Preventative care helps avoid chronic medical problems that are in the main diverse of healthcare costs. We need to stress the importance of preventative care and provide education building habits that will help people live longer, healthier lives. See, once again, this reminded me a lot of Marianne Williamson, but it was a little bit more surface level. It didn't go in depth like Marianne did. Or so maybe he might do it. Let's see if it goes into it with this, because he got a good list down here. Patients should have low-cost access to essential preventative care like physicians and cancer screenings. By focusing on our citizens' health before they get sick, we can reduce the huge costs associated with managing chronic health conditions. Okay. In addition to more preventative health care, it's essential that we recognize the impact of factors outside the clinical or hospital that contribute to the health outcomes. We must teach healthier habits to young people and children. Okay, so he's directly in line with Marianne Williamson right here. And Marianne Williamson comes up with the motto about educating the children early. She has a whole policy on that, on early childhood development, all that. Eating an apple a day may not keep the doctor away, but it does promote healthy eating, teaching kids the basics of nutrition, diets, and providing them healthy meals at school, and provide early screenings to identify flags like behavior issues and different types of diabetes. Disabilities are key pieces in building towards positive outcomes. Tackling these issues early give kids the best shot leading at healthy life. Once again, very Marianne Williamson-like, but does not go in details about explaining high fructose corn syrups and all of that wreaks havoc, which causes some of these issues. So once again, he's in the right direction. He's right there with Marianne Williamson, but not quite, going there enough. Like, he's almost there, but not quite. 13.7 million children. Once again, he does have the numbers right. I give him that. He stays on there with the numbers. And adolescents and 93.3 million adults in the U.S. are battling obesity. Once again, I give him a point for this. He's now mentioning the obesity epidemic. Genetics is a factor, but so are a lack of physical activity and consumption of ultra-processed foods. Exercising for people all of ages has been recommended by physicians to prevent and help not only obesity, but also cardiovascular diseases, strokes, type 2, diabetes, many types of cancer, screening, depression. So once again, Marianne Williamson and Andrew Yang's policies go hand in hand. Each one of them got something that the other one needs. Like, that's why I say it just makes sense for them to combine the ideas. It should be a Yang Williamson presidency or vice versa. Williamson Yang presidency. Their policies directly complement each other. It's just, he's just missing a little bit of what Marianne has, and Marianne is just missing the percentages that darn Andrew has. But they both complement each other. We have seen a significant reduction in the use of combustible cigarettes and tobaccos, but there is always room to improve. Nearly 38 million American adults smoke cigarettes every day, and 9 million vape, not including the recent spike in numbers of youth vaping. The risks associated with smoking, whether combustible cigarettes or e-cigarettes, pose a long-term health hazard that we must continue to combat. Low-income Americans are often faced with a terrible choice to buy food or pay for medical care. Increasing Americans' buying power through the freedom dividend will create great new demands for healthy grocers to open stores and food deserts. By elevating constraints on access to care and to healthy foods, we can improve people's lives and reduce the amount of money we spend on long-term care. Honey, give me an extra $1,000. I can definitely afford to eat more healthier, honey. Matter of fact, that's the one thing that always restricted me is because I never had the extra money to, buy the extra cost of items. The soda costs $1, but the darn juice costs $4. But give me $1,000 a month, I can darn spend the $4 on the darn healthy thing of juice. So I'm definitely here with the freedom dividend, giving us more money to make the healthy options, honey. America is one of the most developed countries in the world, but 41 million Americans face hunger, including nearly 13 million children. Food insecurity disproportionately affects households with children led by single women and people living below the poverty line. Honey, I know, honey. Other families are scraping by their income, make them ineligible for any form of federal food assistance. Honey, I know. I can't even qualify my damn self. Food security through public health intervention not only ensures Americans have enough food, it has the potential of reducing the development of malnutrition, cardiovascular diseases, and other health risks. The extensive problem has a solution, but it needs the support of the food banks, clinics, and the federal government. We have to build programs that create partnerships between clinics and food banks to address food security and health. Indianapolis has implemented a program like this in 2017 and continues to serve an average of 135 households in the community. Imagine how many Americans we can promise nutritious foods at the table by implementing this on a larger scale. So as President Andrew Yang encourages doctors to educate their patients about the importance of diet, nutrition, and physical activity on overall health, incentivize integrated preventative care and healthy activities like gym memberships, biking to work, consuming fresh produce, offer incentives for food banks and clinics to partner together to promote food accessibility, reduce health disparity. Americans deserve better quality end of life care. Okay, this is the last point, and then I'm going to put some food in the oven, y'all. Shoot, the time that it's going to take me to go through number 5, I can get my darn prep potatoes darn cooked. See, I'm going to start practice my healthy eating tonight. I got me some darn stuffed darn potatoes that I'm darn going to eat. I'm now being off Mountain Dew since September, so October, November, December. So 4 months clean off the Mountain Dew. I'm doing my part on a budget. So this the last one, y'all, and then I'm going to take a break. But of course, y'all won't notice it because I pause the video and then start back. So inner life care should provide comfort and choice during the sensitive time while respecting the wishes of the individual. Despite the increasing population of Asian Americans, only 30% have end-of-life care discussions with their loved ones. We need to ensure that people head to the decision informed with a clear plan so that they can spend their last days in the manner of their choosing, not at the whims of the healthcare system. Many providers try to prolong end-of-life care to get as much money out of dying patients as possible. 8.5% of health spending goes towards care for people during their last years of life, and families average out-of-pocket costs for end-of-life obligations of $11,618. Incentives under fee-for-service results in more use of end-of-life care services, including more transitions among care settings, hospital days, intensive care, emergency care, and late enrollment in hospice. These kinds of services jeopardizes the quality of inner care life and add to its costs. Access to palliative care, decrease emergency room visits, increase patient quality of life, increases overall survivorship, and improve cost savings in Medicare programming because of proactive care. Increased knowledge and preparedness of end-of-life care will allow patients and their loved ones to make informed decisions about their care. 71% of Americans say they, given the choice, they would prefer to pass away at home, yet only 25% do. We should give them that choice and guarantee they will be properly cared for. As president, I will encourage providers to have direct and honest conversations about end-of-life planning. Allow for patients and families to be more involved in decisions around end-of-life care. Respect a patient's decision to choose home care even when it won't extend their life. Take into account quality of life instead of just length of life for terminal patients. Ensure that there are enough doctors educated about the end of life and palliative care to provide effective treatment rather than acute medicine. And that would have been very effective for my darn old sister that I always had my political spars with. She was a strong Republican that lost her battle last year to full-blown HIV/AIDS. She started out with HIV, developed into full-blown AIDS. Last time I seen her, she was doing well. Next thing you know, her brain went into a fried state, and then she ended up having to have care from her other sister around the clock. Then she ended up being in the hospital long term, and she ended up dying ultimately in the hospital. They never gave her the option until last minute of possible hospice, like literally to the point where they couldn't milk her insurance no more. She was starting to run low on the funds and stuff at Cape Kill of all that. If y'all from Fayetteville, y'all know what I'm talking about. So they wait literally to the last days. You know you can't do nothing for it at this point. But instead of doggone sending her home earlier for where she could have passed quickly in front of loved ones, the other sister and her family made it there to the hospital a tad bit too late. Versus if she would have been at the house with them, she could have passed with the immediate family. So I am definitely here with Andrew Yang on this. Another point for Andrew Yang. He's coming through with the unique points, honey. So now we're going to go into number 5. And I'm going to pause the video right here, so I will be back. Okay, number 5. Coverage should include all aspects of well-being. We are now breaking a record on my channel as of the day. This is now going to surpass the video that was just my longest video on YouTube, which I set at the end of the last year. Now we begin the new year with another. Is this going to be a new trend now where I start finally getting into multi-hour videos? So I guess we finally breaking the 2-hour mark on my channel. I now got 2 videos that got over 2 hours of, content. Maybe, the next goal is for me to do a 3-hour video. Whew. I don't know. It is going to take me another time. Give me out to June. I might can work my way up to a 3-hour video. But shoot, the way that this thing is, I might end up making that darn old thing today. Oh no, okay, that's the last bit. Okay, thank goodness. I was about to say, shoot, we might end up doing 3 hours a day. I ain't even going to be able to watch my Love and Hip Hop tonight at this point. Ooh, it's a lefty list though. Ooh, child. Ooh, child. Let's go and get into it. But anyways, what does comprehensive care mean, y'all? Once we control the cost of healthcare, we need to address the fact that current levels of coverage are inaccurate. We must do more than just expand the level of services provided to all Americans at the edges. We need to ensure the comprehensive care that includes all aspects of well-being, such as integrated mental health, sexual health needs, maternal health needs, care for a person with disabilities, and dental, vision, regardless of sex, race, or income level. Comprehensive care is not just a moral imperative, it makes economic sense. A robust healthcare system with comprehensive services where everybody has accessible and affordable coverage and no one goes bankrupt will build a healthier population and reduce our expenditure on long-term medical costs. Then we go into mental health coverage. Mental health is an important component of our overall health. It should be treated that way by our healthcare system. There is a mental health crisis in America with 1 in 5 adults experiencing mental illness annually. Our life expectancy is declining due in part to increasing rates of suicide, especially amongst American youth. The teen suicide rate has gone up 56% from 2007 to 2017 and is second leading cause of death for Americans between the ages 10 and 34. 7.7 million youth aged 16 to 17 experience a mental health disorder each year, but only half receive treatment. Anxiety and depression levels are at record highs. People of color and LGBT communities also experience higher risk of mental health issues due to disproportionate social and economic challenges. Honey, speak on it. When you darn gone afraid of darn gone passing a red light and you might darn gone get tossed around like a rag doll by the police. You darn gonna get profiled for barbecuing in the darn gone park, for sleeping in the darn gone library, get shot for darn gone driving around black, get choked out for darn gone selling darn gone cigarettes on the darn gone corner. Even a darn gone 8-year-old black kid get the cop called on her for selling darn gone water without a permit. When we have to go through that, you damn right we deal with some darn gone anxiety issues. When we darn gone met with hostility as opposed to darn gone concern. A cause for concern. Honey, they don't be concerned with us, honey. Darn gonna treat us like a violent animal upon darn gonna approach. And then, of course, LGBT, the high astronomical amount of rates of transgenders that get darn gonna killed. And then the deaths be justified. I mean, it's not justified, but they try to justify, oh, well, she tried to trick somebody. All that doggone bullshit. That's another video within another day. But, you know, LGBT trans deaths at all-time high. Then the suicide rates of everything from the president doggone kicking the transgenders out the army. Although, looking at it now, honey, that ain't necessarily too bad of a thing, honey. I'm glad you disqualified me, honey. When the draft comes, honey, don't be sending a darn gone note, he, she, we way. Shout out the darn gone Flame Moreau, bitch. The darn gone he and the she and me is not darn gone serving, baby. If you can darn gone get away with not serving due to your darn gone bone spurs, Mr. President jumping from foot to foot, Donald Trump, honey, I stand by that darn gone paper where you said transgenders are not going to be able to be in the army, boo. Keep that darn same rhetoric when it comes time to recruit some more people up in there. Honey, bypass Diva Wan's house. Okay? But anyways, for the people who were in there already serving, they should not have been dishonorably discharged. See, this is the stuff that we had to go through. And then when we had to get and take medication for our anxiety, I know I'm not darn LMA, but my vocals are getting better with the new year. But anyways, this is the stuff that we have to deal with. And when we had to take some medication, we had to go to therapy. We had to encompass more challenges with the darn gone costs associated with it. So the Yang Gang and Andrew is speaking to me. He really is with these policies. Our life expectancy is declining due in part to increasing rates of suicide, especially amongst American youth. And then, okay, I just went over that. Our veterans also do not receive the necessary mental health treatment they need when they come home. 22 veterans commit suicide every day, since many don't seek treatment due to embarrassment or shame. And then when they go there, they have to wait in the, the long lines and all that. Now, I will give Donald Trump this. He has somewhat been cleaning up the long lines with the veteran offices and have been doing his part with the veterans, the ones that are not of the LGBTQ community. So I will give y'all to the Donald Trump gang members. I don't know why y'all follow me at this point. I done made it clear that I don't go for Trump, but I still have Trump followers. So that's one point to the Trump followers, that he has been doing his part with trying to half-ass get the darn gone army together. He done kicked out the darn gone ones who had the courage to serve. And then, but you at least darn gone trying your part to help out the veterans, making sure that they are not dealing with the as long lines. But I'd rather have somebody in office such as Andrew Yang that's going to be consistent with everybody, not just darn gone cherry picking who you going to darn gone want to treat, honey. Who you going to give veteran benefits and shit to. Who you going to darn gone allow for an easier quality of life. But if they don't follow your personal belief systems and stuff, oh no, you transgender, we're going to allow to discriminate against you. You get out of the army. and we're going to give you a dishonorable discharge. Who the hell is you to give somebody a dishonorable discharge and your ass, and then come to find out, ain't nobody in your sorry ass family darn gonna be. And excuse my language, y'all, but to come to find out, him, his daddy, his sorry well, of course, you know, by the time you get to the grandparents and shit, they from another country. Cause darn on Donald Trump is just a second generation. But come to find out, none of your American darn on people and never served in the army. Your children ain't serving. When the draft comes, is darn on Trump Jr. gonna be on the front line? Hell no, no. And guess who else won't be? This darn on transgender woman won't be on the front line, Idaho. But anyways, let's move on. I got 10 minutes to my potatoes done. Let's go ahead and clear this on up. We was focusing so good. We was doing so good with mentioning actual decent candidates, and then I had to end up messing it up by thinking of that Agent Orange that's still in office. One can only hope that his behind gets removed just a couple months before the re-election. Serve his behind just right. Give us the August. And then that way it won't even give Mike Pence enough time to even set up, because I think, you have to be at least in the running by March. So if they play their cards right and at least get Donald Trump out of there by then, we will only have to deal with Mike Pence for a couple months. But anyways, anybody's better than both of them. But definitely, Yang is definitely proving himself with these policies, honey, because then he goes into talking about substance abuse. Mental health account for 1 in every 8 emergency department visits. Only 43% of Americans with a mental illness receive treatment due to inadequate insurance coverage and provider shortages. It is urgent to integrate mental health care into insurance plans and destigmatize mental health care while encouraging an increase in the number of people able to provide treatment. That's a new word for me, y'all. So excuse me that I stumbled on that for a moment. Outside of mental illness, applying evidence-based stress relief methods in hospital has been shown to shorten the length of stay. This is just one example of how caring for a patient's mental health has demonstrable cost benefits by creating a healthcare system that recognizes mental health as an integral part of physical health. We can improve both. And then as president, he basically summarizes everything up with that right there. Highlighted for some of my dyslexic folks. That might help y'all with, I know some people who suffer from dyslexia. Although y'all probably got y'all computers set up though, so that just defeated the purpose. If anybody's watching this that got dyslexia, y'all probably already got y'all laptops formulated to look at the screen differently than how it's showcasing on mine. But then it goes into care for disabilities. Today, 1 in 4 people have a disability in the U.S., but 1 in 3 people with a disability do not have access to a primary health care provider and has unmet health care needs due to high costs. People with disabilities are much more likely to experience secondary complications that exacerbate their medical conditions and often need fast access to hospitals and treatments under the current system. These people disproportionately lack the access that they need because of high unemployment and homelessness rates and higher rates of poverty. Additionally, there are issues with accessibility both at healthcare provider locations and in transportation. 13.3 million children in the U.S. live with special healthcare needs. As the father of a son with autism, I understand the hardship millions of American family faces every day. Children with disabilities need a wide range of medical and long-term services and support that our current healthcare system does not prioritize. Either not all medical services are covered, or they are only available in limited amounts through private insurances. 47% of children with disabilities are covered by Medicare or CHIP. Another 49% are dependent on private insurances, and the remaining 4% to no insurances at all. that is 4% too many. Early detection, intervention, and ongoing support is critical for parents of children with disabilities to understand and meet their child's needs. Our healthcare system should ensure all families have access to necessary experts and resources that equally uplift our children. And that affects me personally. Y'all know I have a cousin, baby cousin. Y'all seen him when he was 2. He done gotten grown now. He's like 8 years old. And well, going on 8 this year, and he suffers from autism. So if y'all ever been to my main channel, he's the one that used to have the very long hair that go all the way down to his behind. But we now keep it shut. Well, his father's side keeps it cut short because y'all know my cousin, she suffers from the drug epidemic. So my family you deal with a yang presidency and a myriad of race, from dealing with the crack issues to the father who almost died of cancer. He had stage 3 colon cancer and has now starting to become in better health. And his children has been looking over my cousin who has autism. So a lot of things affects me personally in regards to Yang's policies. From having a cousin who done let her kids almost get lost to the system. Well, thank good for faithful daddies. There are actually good daddies out there that will take care of their darn own children. In rare cases where the mama is the fuck up, where the mama wants to darn go to crack cocaine, and then wants to be turned into a full-on heroin addict. Done went from crack to darn on heroin, honey. Done went from darn get you high to darn speed you down low. Then darn doing a combination of both, speedball. But thank goodness for all these darn candidates actually darn trying to get, facilities and stuff in place for people like my darn cousin. And then Andrew Yang for, proposing treatments for people who may not have private insurance. Because fortunately for my cousin, his father, retired, got ultimate darn retirement benefits and stuff that passes down to his children as well. So, it covers, autism costs associated with my baby cousin, for treatment, for his speech therapy, treatments, and, schooling and all of that. So I'm definitely here with Andrew Yang when it comes to this, especially with dealing with children who have autism. So the final paragraph is we need to ensure all people, including children and persons with disabilities, have equal access to health care they need outside of ensuring Americans with disabilities. I wanted to say American dads for some reason. See, I got to thinking about, the support of dads in my 3 cousins' lives, as opposed to the tacky baby mama. Because every time we always get the stigma of, it's the single mothers, but we always don't praise the single fathers and stuff. So shout out to the single fathers out there, holding it down and doing their parts as well. But compliance at all healthcare providers and covering transportation costs. Technologies such as telehealth will provide new and more convenient ways for persons with disabilities to access preventative care in a format of their choice and at an affordable cost. And then he summarizes it with that. Then we go into HIV/AIDS. And for time reasons, I'm not reading all this, y'all. I'm sorry, Yang Gang. I'm going to cut some corners somewhere. Oh, see, this where he got me right here. Break the patent for Truvada to provide low cost. Okay, you making it low cost, but darn Truvada still got lawsuits for all the darn problems that it caused more than actually treating the problem. Once again, I'm with Marianne Williamson. Let's darn find the ways for the cures, which is already out there, that has already been proven. Let's darn back those darn medications, as opposed to darn something that was just created to darn profitize off of a darn sickness that the government created to darn depopularize certain African populations, but then it backfired on you and darn got into your own communities. But you darn gone couldn't be quick to come out with the cure, because then you would have darn gone been found out. So you let your own population darn gone die down, because we in America, we practice classism in addition to racism and darn gone biological warfare. So we done silenced the voices of people for many years who've actually shown ways of actually getting rid of HIV/AIDS. So no, we shouldn't be breaking no patents for something that's just gonna help darn on alleviate the darn on condition. We should be putting our money behind stuff that has been shown to get rid of the said condition. So this is where Andrew Yang, I couldn't get with him on this one, honey. Like I said, him and darn on Marianne Williamson, if they combine their policies, they would be a dream team. Because he was doing good up until this point right here. He like I said, provide funding for clinics like Planned Parenthood that can screen HIV/AIDS, especially in rural areas. Okay. Reproductive sexual health. Despite the $3.5 trillion spent on U.S. health expenditures per year, the reproductive and sexual health sector experiences some of the widest disparities in health outcomes. Under the current healthcare system, 1/3 of women in the U.S. report skipping needed medical care due to costs, and 1/4 of women who receive care spent $2,000 or more in out-of-pocket expenses. Atrocious, honey. Unfortunately, high out-of-pocket cost deductibles, co-payments, and restrictive legislation have made it difficult for millions of women to access contraception. Honey, and then you got states like Texas, honey, they darn gone so strapped to darn gone repopulate a certain demographic of the community, they trying to ban over-the-counter darn gone contraceptives. Not only is you trying to close down Planned Parenthood, but then you're making it increasingly difficult. Then you coming out with all these absurd laws that is like the Handmaid's Tale, honey, art imitating life. Is you hunting you, or is you hunting me? Honey, darn gone, Handmaid's Tale is starting to become real life down in Texas. I'm trying to figure out, well, who is inspecting the plumbing to check the semen quality. Do y'all know that there's a stupid law in Texas, and I'm trying to figure out who's implementing this. If you're caught ejaculating, and then there's a semen in the darn gone, if there's a sufficient amount of semen up in the in your what's it called, where the toilet, in the pipes or whatever, you can be fine. I'm like, well, what type of, is the semen clogging up darn gone toilets and shit? I'm like, number one, who is the darn gone semen inspector? Who is darn gone? Is the plumber on a secret payroll where if they have to come and fix the pipes and they see that you darn gone been shooting off in the toilet, you know, children? Well, my darn gone videos ain't made for children anyway, so y'all shouldn't have nobody under 18 in here, but we're going to get real. Texas darn gone going as far as to talk about they finding people for darn gone ejaculate. So in one instance, you demonizing people who have HIV/AIDS. But then you want to try to find people who is practicing the abstinence? Like, which one is it? And, I mean, it's like, oh my goodness. You darn gone trying to prevent darn gone women from having abortion of any circumstances. Like in Texas, they tried to make it where even if a person was raped, this is how sad it is. In Alabama and Texas, if a person was raped, even by their father, even if they were, let's say the child was 14 and was raped by an adult uncle or father, they were still forced to carry their sibling, their family member. You know how darn on psychological damaging that is just for a teenager to carry a baby alone, but then a rape baby, and then it's by your own biological family member, so the baby's going to have some birth defects and stuff on top of that. And then you as a state, you uphold that. You actually have states that was trying to make it where even if the darn on, if the person was raped, if they were a trafficking victim, they could still darn on not abort the baby, even under those types of duress of circumstances. Just ridiculous. And then, like I said, the darn on, finding people for ejaculating. Like I said, who is darn on inspecting the darn on pipes? I need to know. Anybody in Texas, tell me, is the plumbers on some sort of secret payroll where if you ever have a pipe issue and they catch a little bit of darn special darn semen juice up in your pipes, they darn gonna report it to the darn Texas government? I'm trying to figure out how this shit gonna go down. I mean, that's just crazy. I know that just got me all off subject, y'all, but that just reminded me of darn Texas with that foolishness with the abortions laws. This is why we need to turn, this is why we need to get our president black blue, because darn Donald Trump was supporting every bit of that darn hands-made tail like bullshit, honey. But then back to Andrew Yang though, an actual qualified candidate that's more deserving of being president. Unfortunately, high out-of-pocket cost deductibles, we went over that. Women do not occasionally decide to have an abortion. Abortion is an incredibly difficult and personal decision. Access to abortion, whether surgical or by use of oral medication, is vital to the respect of women's own bodies and their right to life, health, privacy, and non-discrimination. The Hyde Amendment ban on federal funding for abortions other than to save a mother's life or to terminate a pregnancy that arises out of rape, incest, along with stringent state laws, are a violation of women's privacies. But like I said, certain states try to even go a state further. Even if you got raped, they was trying to make it where you still had to have your rapist baby. And then the darn rapist has darn parental rights. Not only that, but inaccessibility to abortion increases their chances of poverty, unemployment, and dependence on public assistance programs, especially among women of color. The LGBTQ community is another demographic that faces discrimination in the healthcare system. Honey, speak on it. It has not provided quality reproductive healthcare. For example, in several states, gender-affirming healthcare services are considered cosmetic and therefore are not required to be covered by many insurance plans. Planned Parenthood is one of the many organizations that provide non-discriminatory, knowledgeable, and respectable healthcare services for the LGBTQ community, particularly for transgender people. Honey, shout out to the Planned Parenthood. The Title X gag rule threatens Planned Parenthood's funding and 4,000 other family planning clinics across the country, which affects all demographics using these facilities for sexual and reproductive health services outside of abortion. Like I said, just so archaic. Do away with the whole Republican Party for the most part. Not the people, but the darn party, because sadly the darn party don't represent hardly any of the darn people nowadays. Expanding reproductive health care will allow thousands of Americans to stay sexually healthy, limit the spread of sexually transmitted infections, and lower teenage pregnancy rates. In addition to the medical benefits, access to the sexual health care further gender equality by empowering women to continue their education and pursue a fulfilling and economically secure career path. We need to cover the full spectrum of reproductive health care, include STD screenings, contraceptives, prenatal care, and abortion. It should also be inclusive of several services related to transgender people. Come on, shout out to darn Andrew Yang. Between Andrew Yang and Cory Booker, they darn at least keep the darn transgenders in thought, honey, because ain't nobody else really spoke about it in such transparency in their policy. Well, for the possible exception of, Elizabeth Warren, I think. But yeah, between Cory Booker and Andrew Yang, they have been the most consistent thus far. Our healthcare system should encourage Americans to prevent and maintain or diagnose and treat their sexual and reproductive healthcare needs without fear of financial restrictions or stigma. Access to sexual and reproductive healthcare is just as important to the overall health as well-being of people's lives as in an annual physical checkup. And then as president, he goes into that. And then we're going to go into maternal care. Okay, for the sake of time's sake, we're going to scroll through these last points right here, but we're still going to highlight some of the most important things out of here. The U.S. has made strides in lowering the infant mortality rate, but not enough attention on resources are placed on maternal care. Only 6% of grants for maternal and child care actually went to health of mothers, and only a fraction of nation obstetric research is focused on maternal health. We need to place more attention and care expecting the recent mothers in healthcare system. We need to ensure that every mother has access to quality care that she and her baby has. Oh, wait a minute. I guess I need to highlight this though. Black women who are 3 to 4 times more likely to die from pregnancy-related causes than white women. This is unacceptable. We must ensure that every woman and mother access to maternal services. Honey, come on with it, Andrew Yang. Because when you're Beyonce and worth $500 million and still nearly died on the operating table, when you're Kenya Moore and you're worth $1 million and you still die on the operating table, when you're a Serena Williams and it's the highest paid female athlete in sports who is worth $150 million, you still almost die on the operating table and then end up contracting blood clots. There is a severe problem. So shout out for Andrew Yang for pointing out the double standards that black people have to face, where we're 3 to 4 times more likely. Even if we're in an economic situation, we still don't fully get seen the same way. So I'm definitely here for this invest in explicit bias training for healthcare providers to ensure black women receive life-saving maternal care. Although that can just be avoided altogether. We won't have to deal with biases if you just hire more of us, black doctors for darn on black women. Then we go into the dental and vision. Let me find out if I can get me some darn on, veneers and, porcelain crowns with this darn on dental plan, baby. Okay, I don't see no extra stuff for me. But that's okay. At least if we can still get the basics out. Oh, my bad, y'all. I accidentally darn on hit my thing. I was trying to hit this bottom thing, as y'all can see. Y'all done seen all my notifications on the low. Oh, shoots. Let me move my thing up, y'all. See, now we at the last bit. My darn on potatoes done. And this thing now wants to act up. So that is all the stuff that he's providing for dental. And then the last bit is Burton businesses. Health insurance is America is tied to employment because of a historical accident when Franklin D. Roosevelt froze wages during World War II to fight a labor shortage. Employees competed for workers by offering various benefits, including health insurance. Since then, we employers have become the primary sponsors of health insurances in the United States. We still have this system, even though it has become a burden to businesses, constrained innovation in new businesses formation, and trapped America in the wrong jobs. Now, when they did get a child over there, see, I'm glad. I'm going to be glad to get out of this apartment. Like when the world is a baby. Now I'm hearing the darn on baby through the walls, y'all. That's why my darn on mind was thrown off. I'm like, what the world? I know I don't got my TV on in the other room. But anyways, today many new jobs are temporary or gig work. One of the biggest factors driving the gig economy is the cost of insuring employees. Businesses spend thousands of dollars per full-time employees in healthcare costs. So to limit these growing expenses, many employees are choosing to hire people as independent contractors. Yes, they are. This way, they don't need to pay for their health care. We need to give more choices to employers and employees in a way to remove barriers for businesses to grow. As president, I will explore ways to reduce the burden of health care on employees. on employers, including by giving employees the option to enroll in Medicare for all instead of an employer-provided health care plan. Okay, finally, the last one, y'all. So we down to the last stretch. Now, shout out to everybody who's been with me through all the way through. This is our longest video in history. I almost made it to the 3-hour mark, but honey, we ain't about to make it there today. I got to watch my little bit of TV, respond to these job offers, get ready for my birthday, so many other stuff that I got to get ready to do tonight. Y'all see how long I've been with y'all? It's 9 o'clock at night, y'all. And I don't want them to get to knocking on my darn wall because I'm talking and my voice carrying on through. That's why I'm lowering my tone a little bit, because now they done got children over there. It's like this is a 2-bedroom apartment. It's like, why in the world is it 6 people, 7 people over there? Like y'all darn gonna, no offense to my Mexican folks. I know y'all darn gonna have it hard out here. Darn gonna Trump ain't making it no better. But y'all know y'all be living 6 to 7 people up in y'all darn gonna places of small halls. That's how they, ooh. No, no shade at all, but it's like all of them working darn on jobs. I don't know why y'all pack like sardines in the house. Y'all actually getting paid darn on $14 and I don't know why y'all over there pack like sardines. What's the world going on? We got some previous inventions or something going on. Like, I don't understand. Is you misappropriating your money? Because you working at a job similar to what I used to work at. You getting paid $14 an hour. I don't know why it's 5, 6, 7 people over there. And then darn on through the grapevine, darn on the landlord done told me they darn on sleeping on the rent. How the hell you sleeping on the rent? There's multiple people over there. But you know, that's a darn on vlog video, y'all. Y'all subscribe to my channel to learn more about that tidbit. Let's get back on to the final point of which y'all came from. This is what you came for. Let's go on back to the Yang Gang. I know the Yang Gang is like, Diva One. We do not care what's going on in your personal life, honey. I know this is the vlog channel and all, but we came from the Yang Gang, so let's get back to the Yang Gang topics. So, is Washington, D.C. actually capable of passing comprehensive health care reform? The best interest of the American people is often not in the interest of powerful players. Is the healthcare industry. Healthcare has become a political animal in Washington, and to grip of these special interests, making it almost impossible to draft and pass meaningful healthcare reform. Okay, back on to the Marianne Williamson mindset. Come on through. Any attempt at legislation gets stalled by infighting and the intense lobbying efforts of the industry players. With the magnitude of healthcare reform that we need, we cannot afford to interference of interest group in our government. Private insurance, drug companies, hospital chains, medical equipment manufacturers, and other private players all hold sway in Congress, but none of them represent the actual patients. For example, ridiculous drug prices are terrible for citizens but great for drug manufacturers, who currently have a lot of influence in Washington. This gulf between the power of the people and the special interest is epidemic in American politics, but especially toxic in the arena of health. Experts advise is important but limitless. Lobbying is dangerous. To pass meaningful healthcare reform, we need healthcare lobbyists out of the room. My plan to raise the salaries of government officials and bar them from transitioning into the private sectors that they regulate will help prevent the influence of industry lobbyists in my administration. To manage healthcare lobbying influence on Congress, I will implement democracy dollars to supercharge the grassroots campaign and minimize the influence of lobbying campaign contributors. Okay, I will give him that. He has been the one that was consistent and unique with the democracy dollars. So another point for Andrew Yang. And then this is what he would do as president. And we're finally to the end, y'all. So ultimately, y'all seen that long, lengthy list for Andrew Yang. He has the longest out of everybody. However, he still did not quite compare to Marianne Williamson. However, he is so complimentary to Marianne Williamson. This is why he is a good second for me. Although he still pales. But honey, both of them, honey, kicks both of their behinds right here. Bernie and Elizabeth Dargon Warren don't have nothing on Marianne Williamson and Dargon Andrew Yang. Y'all seen it with it. Y'all seen it for yourselves. Once again, The darn policy speak for they say, oh Lord, what did I accidentally click on, y'all? I done accidentally clicked on something of Marianne's. But anyways, y'all, the policies speak for themselves. So in my order, y'all give me y'all thoughts, but preferably, Marianne Williamson is number 1. Andrew Yang is number 2. Elizabeth Warren is number 3, but not by far. Like, I believe she's a close number 3. Like, Elizabeth Warren and Andrew Yang are neck and neck. Marianne number 1, Bernie number 4. That's my thoughts on that. So y'all leave y'all thoughts down below. Like I said, Bernie did have some points up on Elizabeth Warren overall, but I still think she's overall a little bit more better. But y'all leave y'all thoughts down below. Feel free to like, comment, share, subscribe. Once again, I look forward to the Yang gang, the Williamsons, the Warren gang, and the Feel the Burn. I look forward to all y'all comments down below. Like, comment, share, subscribe, and I'll see y'all soon with more videos. Mwah.